Meeting of the Veterinary Medical Board to order. Jessica will call the roll.
Dr. Waterhouse,
Present.
Ms. Bowler,
Present.
Dr. Bradbury,
Present.
Ms. Laredo,
Present.
Ms. Mancuso,
Here.
Dr. Noland,
Here.
Dr. Nunez,
Here.
Ms. Yanis.
Here.
We have a quorum.
So we have a quorum. On to agenda item number 2, introductions. And as a part of that, I would first like to recognize Dr. Dick Sullivan, who's been an important member of our board. He started on the board in June of 2012, and he served in various roles, most recently vice president, but also he was the board liaison to the MDC. He was on various subcommittees such as the shelter minimum standards, the alternate premises minimum standards, telehealth, telemedicine, and drug compounding. And I hope he's watching. And I'd like to tell him what an asset he has been to the board, and we want to thank you for everything that you've helped the board accomplish over these last years.
Thank
you, Dick.
My guess is that he's fishing, not watching.
He could be fishing, but. And I'd also like to welcome our new member, Dr. Bradbury. She is from Sacramento. She's an internist at Vista Veterinary Specialists. She was also at Loomis Basin. She's a UC Davis graduate. She went to Texas for her internship and then went to Colorado State, which is actually where I first became acquainted with her. We became sort of bonded over a black Cocker Spaniel named Mandy, who was one of my patients. The clients were traveling in Colorado and ended up at Colorado State, and Dr. Bradbury saved her. So anyway, I'd like to welcome Dr. Bradbury. So this is the time for any members of the public that would like to introduce themselves. It's voluntary, but if you- Thank you. So we're going to first say that we're going to change the agenda somewhat. We're going to plan to close at 3 o'clock for closed session because we're not meeting on Friday. Sorry, you can tell that the air is really smoky out there because I don't normally sound like this. So we are not able to meet on Friday, so we're going to need to do our closed session actually this afternoon. So we plan to close at 3 o'clock and do our closed session. So we will see how much we can get done in the meantime. But we are moving things around from our normal order, and we're going to number 3, public comment for items not on the agenda. Yes. So I think Valerie is going to talk to us about give us an update on the fires.
Good morning. I just thought everybody might like to know what's going on from the veterinary perspective with the fires. The CVMA runs the California Veterinary Medical Reserve Corps, which is a division of EMSA, the California Emergency Management Services Agency, and I'll start with the Camp Fire because that's the fire that we were deployed to as of last Thursday, the day the fire started. We started with a 5-day mission, which grew to a 10-day mission.
Hi, can you speak up? We can't hear you.
We started with a 5-day mission, which became a 10-day mission, and we're now on a 14-day mission and don't know where it's going to end because, as you've all seen, it's a very, very difficult situation right now. We are scheduling veterinarians, registered veterinary technicians, and veterinary assistants, and have been doing so. And they've been working around the clock in the Chico area, particularly. It's incredible how many veterinary professionals rise to the occasion when we need them in these terrible situations. We're continuing to. We sent out another deployment yesterday to more counties and had a great response, so we're scheduling through next Wednesday at this point. As of now, from what we know and from the information that we're able to gather, There are over 2,000 animals in the shelters in the area, particularly at the Chico Airport, which is not the greatest situation for our members working in the field. Oftentimes, we're able to be at an area where there is a veterinary hospital available, but the Chico Airport obviously does not have anything like that. So the members on the ground are taking the, most injured animals, treating them, and trying to get them out to either veterinary practices in the surrounding areas, and many are going to UC Davis. We have a great collaborative effort with the VERT team and with UC Davis Teaching Hospital, and they're taking a lot of the animals in that need the most care. That leaves a lot of still displaced and very stressed out animals at these locations, and we're not quite sure what's going to happen to all of them in the end, because many of their owners are either displaced or did not survive the fire. So it's a really serious situation, but it's just amazing how great the profession is and how they are working in really difficult circumstances, along with a lot of, obviously, other emergency responders. As far as the Woolsey fire in Los Angeles, we were not deployed to that fire. Emergency management starts at the local level, and so they have been able to handle that at the local level, but we know that there are many veterinary professionals on the ground and in the practices there whose practices are full of animals and who have been working around the clock as well. So that's just a quick report. I thought you all might want to get up to speed. That's as much as we know. And we also know that there are a number of veterinary practices in the campfire area that burned to the ground. Most of them did. Thank you.
Such a horrific situation. It's just, and we really want to thank all those veterinarians and RVTs who have come to those areas to help with the animals that are injured. Is there any other public comment? Agenda item number 4, review and approval of board meeting minutes. So first we'll do the August meeting. Good job. I didn't have any corrections. Tara?
The mentions of Dr. Jeff Lazarchev need to be changed to Dr.
Jeff,
Kevin
yes.
Lazarchev. I'm not exactly sure all the pages that appears on, but we could make a global change.
Any other corrections?
Yeah, I didn't find any changes. Good work, guys.
Do we have
Can
a motion to approve?
I motion to approve the minutes
Second.
Okay, there's a motion and a second. Is there any public comment?
with Tara's changes.
Yeah. Public comment? Okay, call for the vote.
Ms. Bowler?
Aye.
Dr. Bradbury?
Aye.
Ms. Laredo?
Abstain.
Ms. Mancuso? Dr. Noland?
Yes.
Dr. Nunez?
Yes.
Ms. Yanis? Dr. Waterhouse?
Yes. Motion carries. Okay, moving on to the minutes of the Thursday, September 4th teleconference meeting. I didn't have any corrections on this either. Any other comments?
That's-
Motion to approve?
Move to approve.
Is there a second?
I'll second it.
So motion and a second. Any other comments? Any comments from the public? Call for the vote.
Ms. Bowler?
Aye.
Dr. Bradbury?
Aye.
Ms. Laredo?
Abstain.
Ms. Mancuso? Dr. Newland? Dr. Noland?
Oh, abstain.
Sorry.
Dr. Nunez?
Yes.
Ms. Yanis? Dr. Waterhouse?
Yes.
Motion carries.
Motion carries. And agenda item number 5, report update from the Department of Consumer Affairs. I think we have Patrick Lay here.
President Waterhouse, Executive Officer Sieferman, members of the board, good morning. It is good to see you all again in Sacramento, and it is especially good to see you all safe and sound given the devastating fires that are raging across California. I hope everyone's families and loved ones are doing okay, but I also want to thank you for being here and forging on and conducting business on behalf of the great state of California. On a lighter note, we also, the department would like to welcome Dr. Bradbury with the Department of Consumer Affairs. Welcome to the DCA family. We're excited to have you on board, and if you have any questions, feel free to reach out to the board and bureau services team if we can assist. I have a short update for you today. For the record, my name is Patrick Clay. I'm the Assistant Deputy Director for Board and Bureau Services at the Department of Consumer Affairs. My first update is regarding the Director's quarterly meeting. As you know, Department Director Grafilo is hosting and will continue to host Directors' quarterly meetings, which are opportunities for executive officers and bureau chiefs to meet directly with the director and bring issues that are relevant to our boards. We hosted 2 quarterly meetings recently, one in August and another one in October. The quarterly meetings included presentations from the California Department of General Services, the DCA's Equal Employment Opportunity Office, and DCA's Office of Human Resources. So to recap the content of these meetings, the Department of General Services previewed their plan for new construction that will house all of the Department of Consumer Affairs in 2024. The Equal Employment Opportunity Office provided a primer and a training for executive officers on implicit bias. And the Office of Human Resources shared some new improvements on human resource processes, internal processes specific to recruitment and adverse action. At the last meeting, the department also presented an update on the salary study, which I'll discuss more later on, and also discussed the legislative implementation of AB 2138, the bill related to license application and criminal convictions. My next update is regarding DCA's leadership training. As you recall, the Future Leadership Development Program was an initiative launched in August of 2017 to develop and mentor DCA staff across various boards and bureaus. The program includes executive mentoring, customized leadership training, and project management. The department launched a kickoff meeting for the second cohort of this program back in September. My next update is regarding the Substance Abuse Coordination Committee. As you recall, the department reconvened the Substance Abuse Coordination Committee. Per Senate Bill 796, the committee has been tasked to examine the standards related to drug testing for substance abusing licensees who are in a diversion program or in probation. A conversation very much related to item 8E on your agenda, when you will discuss regulations related to your disciplinary guidelines and the uniform standards. The work of the committee was to determine if the existing criteria regarding drug testing needs to be updated based on recent changes to drug testing technology and academic research, and report back on January 1st, 2019. Per statute, the committee is made up of all the Healing Our Board's executive officers, a representative of the Department of Healthcare Services, and is chaired by the Department of Consumer Affairs. And thank you so much, EO Sieferman, for your extensive participation and feedback during the committee process. So to recap, the committee met in June and in October and examined the issue of drug testing frequency, essentially how much times per year a licensee should be tested, and whether or not those frequencies should be adjusted. The committee voted to make 2 changes. The first is to allow boards additional flexibility for licensees who are going on vacations or going out of state or needs to be absent. The second change is to allow boards to lower the drug testing frequency if a licensee receives 50% supervision or more in the workplace. So those are kind of the 2 changes that were made. My next update is regarding the salary study. The department has awarded a contract to conduct a salary study of executive officers. As a refresher, the contractor will be expected to provide a comprehensive, independent review of salary levels and evaluate changes that have occurred subsequent to a previous salary study that was conducted by the department back in 2011. This new study will assess the programmatic changes that have occurred the past few years and how these changes have increased the operational complexity of DCA boards. This study will help determine how these changes can support compensation augmentation for executive officers. As you know, the EO salary increase are subject to several layers of review, many of them outside of the department's jurisdiction, and as such, there are key goals that the department hopes to accomplish through this salary study. The first is to evaluate the current salary bands at DCA and collect data and information on the operational complexity of boards. The second is to determine what critical factors are used during a compensation increase review process. The third is to evaluate gender parity for executive officer salaries across all DCA programs. And the last one is to compare positions deemed comparable to executive officers in other states. The study is underway, and the estimated completion time is early 2019. And my last update is regarding board member orientation training, very relevant for our new board members. As you know, board members are required to attend a board member orientation training within 1 year of appointment and reappointment to a board. It's a one-day training here in beautiful Sacramento. Registration is available online, but you can also contact Board and Bureau Services team or your executive officer to complete registration. The next training is slated to be December 5th, with additional dates for 2019 to be announced soon. That concludes my update, and I'm happy to take any questions that the board may have.
Questions?
Uh,
Kathy?
On the employment and compensation study, after the results come back, what is the timeline in terms of implementation of changes that might be suggested?
Yeah, so really the study will be a tool for boards to be able to use to navigate the different layers, to navigate when you have to submit a EO compensation increase. So really, once we have the report, we hope that there will be some mechanisms available to boards. So there's not an implementation per se, but it's for additional information and additional tools for boards to be aware what are the factors necessary to submit a request package that will successfully go through the entire process.
So will this study also go to agency, because don't they actually are the ones that have to sign off on any
I mean,
raises?
the hope is that, the report will look at all these different steps that are required and identify when you submit an application package, what are the factors that lead to, a package that's been increased or a request that's been denied. And so the hope is that you'll be able to see these factors in front of you and make the appropriate decisions on how you want to submit the package.
Dr. Nolan?
You mentioned that there were two issues that the drug testing group was looking at that they might change. One was a decreased frequency with a 50% provision in the workplace. Can you put numbers on that decreased, or has that not been decided upon, that recommendation?
So the changes have been voted on and approved by the committee.
Okay.
Well, let me back up. So the concept has been approved, and our legal team is working through the kinks of making sure that we create a language that can actually work out and includes all the details. But the concept is that a board so currently the testing frequency is set as 52 times per year minimum, and a board may reduce this to 26 times if the licensee receives 50% or more supervision in the workplace that is licensed by DCA. So if you have a direct supervisor and that supervisor works with you half the day or more, and you're on probation or in a diversion program, your testing requirements may be lowered if the board decides to do so.
Thank you.
Any other questions?
Patrick, thank you so much for your update. I do have a question related to the salary study. You had discussed about how the scope is going to include comparisons to executive officers in other states. Will it also include an analysis and comparison to other state positions within California, for example, CEAs or bureau chiefs?
It's possible. I have to double check with our contractor to see the scope, and I'll get back to you on that.
Okay, because my concern is just for DCA as a whole and maintaining and recruiting adequate people candidates for executive officers. As you know, Board of Optometry had a challenging time finding a qualified candidate to fill that position. And I think a lot of it has to do with the fact of the duties of an executive officer. When you can look at a CEA position that has equivalent kind of salary, or even an SM2 position, when they're given an annual MSA, a merit salary adjustment every year, a 5% automatic, and bureau chiefs who they are in charge of bureaus, but they have less responsibility when it comes to enforcement or legislation and going to the Capitol because they can't go and meet with legislatures without DCA there. Testifying, they have DCA there, and they have a lot less real risk, I guess, to that position. But they make significantly more than executive officers. And so if we're concerned about DC as a whole and sustaining adequate candidates and recruiting for adequate candidates, I think that really needs to be looked at, because you can have a CEA position where you have, you could be a manager over one unit and you're making a higher salary and you're getting the annual 5%. And so when I'm trying to convince people, for example, to apply for other executive officer positions, when they look at the salary, that's what's really killing it, because they'd much rather go to an easier position and receive more money.
Absolutely, and I'm happy to take that feedback back to our contractor. Completely understand that the subject is a difficult one. Many boards under DCA have communicated the challenges of retaining talent at the department. The last salary study was conducted in 2011, and part of the goal is to really attempt to put a description on how working at DCA and the work that boards do has become incredibly complex. It's more than running staff. It's also doing legislation, regulations, the enforcement piece. So it's a job that is becoming a lot more complex. And so part of the attempt of the salary study is try to describe how these additional complexities warrant possibly additional salary compensations.
Any other questions? Any questions from the public? Thank you very much.
Thank you so much for having me.
Agenda item number 6, election of 2019 officers, and Jessica will perform this.
Okay, so as you know, we have two openings that are available. We have the president and the vice president. So at this time, I'd like to call for nominations first for the position of board president. Are there any nominations?
I'd like to nominate Dr. Jamie Nolan for board president. You need me to explain it or no?
If you'd like, you can. Do you accept the nomination?
I'd like to make a nomination too,
Okay.
Dr. Mark Nunez.
Dr. Nunez, do you accept the nomination?
I do not.
Okay. Are there any other nominations? No? Okay, so as there is only one nominee who has accepted the nomination, are there any discussions by the board?
Yes. Can we discuss why the pros and cons of Jamie being president? Because I don't see Jamie as having enough time to dedicate to it.
I appreciate your comments, Judy, and I assure you that I will make time.
This is Kathy. I just was going to suggest, part of this is traditionally with its board that, since I've been on it, the vice president has assumed the president role after the president is termed out. And actually in that term, and that consequence, it would have been Dr. Dick Sullivan. And I think Jamie was being considered, and we were talking about as being vice president for the upcoming cycle. Since Dr. Sullivan was not appointed, it still makes a lot of sense in my mind for Jamie to be president, and then we should look to, for continuity, on the vice chair position too, vice president position, because we still have that to nominate. And we have former chairs right here on the board, former presidents right here on the board that could serve in that role. But that's why I put Jamie's name forward, and and I have every confidence that she will be a terrific president going forward for the next year. So that was the reason why that I posted it.
And I have to say
Well,
that I
I
agree.
appreciate-
Go ahead, Judy.
I appreciate that, but my time on the board, which now I'm going into the 9th year, so for continuity, I've definitely been somebody that's been around the longest at this point. And we had public members have been shut out under this existing board for the term since Linda Starr left. We've had several elections, and it has been kept between a couple of members. And we just heard the DCA officer say that DCA is an equal opportunity employer, but yet the Veterinary Medical Board has not been. And I think that it's time for a change. If Mark does not want the president and Jamie is president, then I think we look to a public member to be vice president, let's see, and Cheryl was vice president for a number of years, and then president for a number of years. What is the total years she's been vice president and president?
Okay, right now we're talking about Jamie, but
No, I know, but we're up for discussion right now, and it matters.
yeah, so I was vice president for 2 years and then now president for 2 years.
Okay, so 4 years total, and the term is 1 year. So that's 4 terms that you've done. And then Mark what did Mark do? 2 years as president?
2 years, yes.
Can you tell me the total?
Yes, 2 years, Mark had 2 years as president.
Okay. So it would be nice to, have some diversity, and so since there's no other opportunities here for another president choice, that we should move forward with Jamie, and then I guess we're going to vice president. So, okay, go ahead. I'm done with what I have to say for now.
Thank you, Judy. Okay, and I have to say that Dr. Nolan, I think, has been a great addition to our board. She comes from the large animal perspective, which I think we really needed, and she always brings thoughtful questions, especially about budget. And so I think Jamie Nolan would be a great president.
With that, is there any other discussion? Nope. Okay, can I have a motion to elect the board president?
I move.
Do I have a second?
I second.
And any public comment? Okay, then I will do a roll call. Ms. Bowler,
Aye.
Dr. Bradbury,
Aye.
Ms. Laredo,
Yes.
Ms. Mancuso,
Abstain.
Dr. Noland, Dr. Nunez,
Aye.
Ms. Yanis, Dr. Waterhouse.
Yes.
Congratulations, Dr. Noland.
Or not.
With that, I would like to call nominations for vice president. Are there any nominations for vice president?
Yeah, this is Alana Yanez. I'd like to nominate Judy Mancuso for VP.
Ms. Mancuso, do you accept the nomination?
I absolutely do. Thank you, Alana.
All right, are there any other nominations for vice president?
Yeah. I'd like to nominate, well, it depends on either one of their time, but right now Cheryl Waterhouse for vice president. Nunez.
Do you accept the nomination?
Yes.
Are there any other nominations for vice president? Okay. Is there any discussion by the board?
Well, I'd like for my fellow board members to into consideration what I had to say. I feel I've been completely stonewalled from either president or vice president for my 8 years, and that it has revolved around just a couple of individuals, and it's not right. And the previous boards used to just pass the hat, and that was a very equal way. We are all equal. We are all appointed. We're not elected. We're appointed and we're equal, whether we are an RVP, a public member, or a veterinarian. So I would like to say to my fellow board members, before I term out, I would like for this stonewalling to end of public member and animal person, and consider voting for me. Thank you.
I have a question. I'm just wondering if you've been on the board for 8 years. I just don't know what the term limit is. I thought that was the end, and it sounds like you're in your 9th year. So what does that mean, since I'm new to this?
I'm at the beginning. I just completed, just completed the 8 years this October, so I'll be in a grace period until October next year, 2019. So I have till October 2019. And I would like to experience the vice president position before I roll off, whether I get taken out early or midterm or make it all the way through. I have given my time and energy, money to the board. I got positions, I got people hired, getting VCPs once upon a time. So, I've bent over backwards, and I've definitely earned it. I've earned not only vice president, I've earned president, but I've definitely been kept out of both positions. Thank you.
Ms. Buller?
Hi. As a public member, and I want to speak up for public members as well, and I don't want to think anyone to think that I'm shirking any responsibility. I would very much enjoy being an officer of this board. I love the board, and I work very hard as well, and I'd be very interested in the vice president position. However, the situation right now, and I understand what Judy's talking about in terms of public members and veterinarians on the board, but the situation right now with a brand-new executive officer and a number of new staff leads and that she is bringing on, I just think that having continuity and knowing the time that it takes to run the board, to really do what's been necessary in the last few years on this board that I've been there, I really feel like with Jamie as president and with Cheryl as vice president for another year, working with Jessica. Cheryl's had the most experience working with Jessica and her new team in the last 4 months, really. It just gives us, there's a lot of things on the horizon, and I just think it gives the board a little bit more strength, and I've been looking at it from that perspective as opposed to public versus non-public members. So that's the reason why I nominated Dr. Waterhouse, and at some point I would love to be an officer as well, so thank you.
I have both historical and institutional knowledge that even goes beyond Cheryl and everyone else on the board. So as far as continuity goes, and the vice president's role is not as great as the president's role anyway, but I'm sure Cheryl would be there to assist and help, since she has fulfilled 4 terms already.
I have a question, and I always pick on Tara because she knows a lot of things. So Judy has been on this board for a long time. She's very passionate. She advocates for the animals, and I do think she would do a great job as vice president. My concern is that she's in a grace period, and I want to know, Tara, does she have until October, or can she be, a horrible term, but replaced at some point?
So according to the Practice Act, I'm reading from Business and Professions Code, Section 4802. each member shall serve until the appointment and qualification of his or her successor. So right there, that means that a new member could be appointed at any time now. Or the member serves until 1 year shall have elapsed since the expiration of the term for which he or she was appointed, whichever occurs first. So since she's in the grace period, she could be replaced before October 2019. If she is not replaced, she would serve a full 1 year term, and then that would expire.
And to clarify, our board records indicate that her grace period is actually up in June of 2019. Is there any more discussion for the nomination of vice president?
Yeah, I'd like to say one last word, is I'd be happy to serve till June, and then you can have Cheryl, Mark, Kathy, whoever you want then. So that would be very nice and considerate for my fellow board members to vote me in until June. Thank you.
Is there any more discussion? May I have a motion to elect the board vice president?
I guess it's Kathy, I'll move it.
Is there a second?
Second.
Wait, are we moving?
Yeah.
I'm sorry, what's the motion?
Just to start the election.
Oh, to start the election,
To
yes.
elect the vice president.
So when we vote, do we say who we're voting
Yes.
for?
Yes.
Okay.
So we have Dr. Nunez seconding. Do we have any public comment? No. Okay, so at this time, since we have two members who are nominated for vice president, when I call your name, if you could say who you are electing. Ms. Bowler,
Dr. Waterhouse,
Dr. Bradbury,
Dr. Waterhouse.
Ms. Laredo,
Judy Mancuso.
Ms. Mancuso,
Mancuso.
Dr. Noland,
And Dr. Waterhouse.
Dr. Nunez,
In a nod to diversity, the last man standing on this board
Oh, yeah.
votes for Dr. Waterhouse.
you are.
Ms. Yanis, Dr. Waterhouse.
For Dr. Waterhouse.
So we have 3 votes for Ms. Mancuso and 5 for Dr. Waterhouse. So congratulations, Dr. Waterhouse, for vice president.
I will be happy to turn this gavel over in January.
All right.
Okay, thank you, Jessica. Moving on to agenda item number 7, the MDC report. And we're happy to have Dr. Pollard here.
Jeff Pollard, MDC. Good morning. So we had discussion on 3 agenda items listed in the packet as 5, 6, and 7, so we'll just go down the line. Number 5 was a continuation of the shelter medicine minimum standards, and I think the conclusion will be that it continues. We discussed 2 regulations. The bulk of the discussion centered around 2 regulations, 2035, duties of a supervising veterinarian, and 2030, both existing and then some proposed additions to 2030 minimum standards. There was some agreement and some discussion about specific language, and I think the newest item that will surface going forward is public comment. Specifically, Erica Hughes, Animal Welfare, suggested that we solicit input from private veterinarians who offer services to shelters, and we will consult with executive officer about that point and perhaps requiring a subcommittee to address that. We did not come to a motion on current language, so we will need to continue discussing this. At present, Ms. Laredo and Dr. Drusis are the subcommittee handling this. Questions? The next item, agenda item 6, was a continuation of the discussion on intraoral dental radiographs. As you know, the VMB tasked us with the specific question of whether having dental intraoral radiographs should be mandated, or the capacity to do them or refer them out. The discussion was very similar, I think, to the last meeting's August discussion. We had a list of policy white statements from all of the acronyms, the AHAs, the Dental College, the AVMA. Public comment, I think, was pretty consistent with even what committee members discussed. The general consensus, I think I'd use as one item in the packet, which if you want details, I'd encourage you to view the webcast or look at the packet, referred to a poll of veterinarians on the committee, on the online veterinary committee of VIN. And it was interesting to see in this group of 50, 100,000 veterinarians, I don't know how many exactly, but it's quite a few. In the 3 years between 2015 and 2017, the number of practitioners that have dental x-rays in their practice increased from 39% to 50%. So I think both looking at that and reviewing our discussion yesterday and back to August, I could probably say the same thing. I don't think it's a question of if, but rather when. But in the interim, we had a motion proposed and a vote, and the vote was 6-2 to maintain the current status. There was further discussion about what I would probably best characterize as informed consent. And it involves specifically whether people who have dental radiographs or those that don't discuss that fact with clients when they are presented in the exam room. Because it has come to light recently, at least to me, that not all clients are aware of what a cohat or a dental cleaning or the various iterations of the process are. And I don't know when. I do expect at some point we in California and probably elsewhere too will have dental x-rays in their practice in greater number, whether they're required or not. But in the interim, it seems to me that, and people on the committee, I think there was certainly overwhelming, if not unanimous, consensus that clients should really be informed about what they are agreeing to. And it involves more than just cost. It involves more than just teeth extractions. And so I think we might consider approaching the issue from that vantage point. Questions?
Well, my question is to Tara, in regards to, I don't think that we have the ability to enforce informed consent on whether or not a client should be made aware of the necessity of dental radiographs and then having the option to sign out of that option with informed consent. I don't know how that would apply to minimum standards, which is what this board establishes.
First off, I'd say that the conversation yesterday with respect to whether or not intraoral radiographs are required centered on the minimum standards as applied to a fixed facility. And what we're, I think, really talking about is whether or not the veterinarian believes that x-rays and radiographs are necessary as part of the diagnosis and treatment plan, which is the action of veterinary medicine versus the minimum standards required at the facility.
The proposed minimum standards for fixed facilities is going to state that they have radiographic capability or the ability to refer to a facility. But the discussion at the NBC meeting yesterday was whether or not there's a there's a difference between dental radiograph and routine radiographs that's done for abdomen, thorax, extremities, and so forth, which I believe there is. And so I think another consideration is whether or not dental radiographs could possibly be an additional standard on minimum standards, or whether or not informed consent can be a way to go. Because the reality is, even though it's minimum standards, in my opinion, if a dental case ever goes to a complaint level, then standard of practice will say that they should have done dental radiographs in almost any case involving that issue.
In terms of informed consent, I think that, this is just off the top of my head, but possibly the record-keeping regulation comes into play because there has to be documentation of the treatment and intended treatment plan. Also, as part of the veterinary client-patient relationship, I think that informed consent might fall under that as well. I would like to research that issue. If you think that the question is whether or not informed consent is required, I think there's.
Well, I'll give you another example. I know that there have been some complaints that have gone to the board level that have cited the lack of pre-anesthetic blood testing be recommended or discussed prior to anesthesia. And although that is not in minimum standards, accusations have been filed and discipline has been taken for that not being done. I can see that it's a very easy stretch for not doing dental radiographs to be applied in the same manner.
And I think that the drug counseling that we're now required to do after January 1st is kind of an informed consent as well.
I would disagree with that. With the drug counseling, it's more about information delivery rather than receiving informed consent from the client, because you don't have to get the client's acceptance to.
But essentially, that's what you're doing when you're giving drug counseling. You're telling them, this is the effect, these are the side effects. Do you accept this drug?
Well, I don't think
But
it.
anyway, that's a side issue. But
Right.
it's- to me,
Perhaps
it's in the
there's
same vein.
consent involved with that discussion, but I think that we're talking about SB 1480 now requires, as of January, veterinarians or their supervised staff, as applied in that statute itself, provide specific information on drugs being administered to the animal. So that's a drug consultation. But it's primarily aimed at delivery of information about the medication being administered, presumably at home. As far as we're having trouble with standard of care issues. And 2032, which is minimum standards of practice, provides that all aspects of veterinary medicine shall be performed in a manner consistent with current veterinary medical practice in California. So to the extent that
So does that statement say you should do dental radiographs?
it's
In the same
case
way that that
specific.
statement says you should do pre-anesthetic blood work?
It's case specific, and if the general community would perform intraoral radiographs or other testing to diagnose a certain problem, or X-ray prior to performing any surgeries or
Extractions
right.
and post-extractions?
Right. It's really a matter of everyone starting to do it rather than the board requiring it. Because if we start with requiring as a minimum standard of practice, you must take intraoral radiographs of the animal prior to doing certain kinds of oral care, then what was argued yesterday is that we start putting our fingers on every kind of type of practice, which could include, was it orthopedics, or I think Nancy was talking about.
MRI and CT and.
Right. So, other specific kinds of practice of veterinary medicine. So I think what was decided yesterday is we don't necessarily need to start dictating by regulation the minimum standards for certain types of veterinary treatment.
Agreed. And as far as the consumer goes, of course, I'm an advocate of pre-anesthetic blood work and dental radiographs. But in fairness to a veterinarian, I am also concerned about the ambiguity between minimum standards and standards of care. It does possibly create some confusions, and I'm hoping for some sort of resolution to that, possibly in the form of informed consent. But I'm not sure how that would be applied, or even if it could be applied.
When I'm thinking about enforcing these regulations, I'm thinking of what a disciplinary action would look like, and typically it would come in the form of an allegation of negligence or incompetence.
Exactly.
Under unprofessional conduct, but it's all very case specific. If it was ultimately determined that a tooth should have been removed and the radiographs were not actually performed, then potentially that is a violation of
The standard of care.
yeah, it is a violation of the standard of care based upon negligence or incompetence. All of these things are very fact specific. So potentially creating a mandate by regulation to address case or fact-specific cases, it seems like everyone just determined yesterday with the vote that was going too far.
And yesterday at the MDC meeting, the executive officer gave an enforcement report. I'm not sure if she's going to give a similar report at this meeting, but she cited that the number of complaints received by this board has practically doubled, and that there was going to be some review of how enforcement is done. I'm not sure what that meant, but perhaps this is an example of how enforcement can be evaluated or addressed.
Basically, it's also part of the discussion with consumers not being able to afford x-rays and intraoral dental radiographs, and because of
But I don't think the cost is so much a factor for us as it is that there are many other clients out there who assume that they are being done.
Yeah.
It's news to them that they weren't.
Mhm.
Because when they go to their own dentist, they get dental x-rays. So they assume that veterinarians are doing it.
Well, and is that incompetent or negligent practice for not properly communicating to the client what the procedure is going to be, what is involved in the procedure, because with the intraoral radiographs, they have to be anesthetized. So, that is relevant information to the client to determine whether or not they want their animal anesthetized. I know in some cases, again, case specific, some animals don't do well depending upon their underlying diagnosis. If they're anesthetized, the client needs to know that. So if they're not being told that these x-rays are being performed or not performed, it comes in the form of negligence.
So I think what Dr. Nunez is asking, I think, would it be reasonable to ask veterinarians to have them get informed consent before the procedure is done? Would it be appropriate to say that veterinarians have to tell their clients whether they have dental radiology capability or not? Is that what you're getting at?
Well, my concern is that when expert witnesses are being trained on how to evaluate cases, oftentimes the focus is on minimum standards, but the outcome is often on standard of care. And so maybe it's a matter of training of expert witnesses, or maybe it's a matter of educating license holders about how our expert witnesses are being trained, and what the expectation is. I mean, you can read the Practice Act to find out what minimum standards are, but there's no way you can read what the standard of care is. And if our expert witnesses are applying the standard of care, I'm a proponent of the standard of care, of course, but I think that the license holders need to know what that is.
Kathy?
Yeah, and this, Kathy Bowler, I was there actually for the discussion all day yesterday at MDC, and from a consumer perspective, and I totally understand sort of how it's hard to thread this needle, but it would be nice if there is a way that consumers can be informed in a way about the availability of x-rays or not availability of x-rays, and in the informed consent that Mark is talking about. I'm not sure, we don't want to change the Practice Act and standard of care, but it would be, maybe it's an educational thing from the vet board, but from a consumer perspective, I know enough to ask and to question it, but a lot of consumers don't, just like Cheryl said, and just like we heard yesterday. They assume that these are being done. Sometimes they're not necessary, but they just assume they're being done, so.
Dr. Bradbury?
Yeah, it seems like this, like I actually see cases that have roots that are left that haven't had x-rays taken post-dentals, but it seems like it wouldn't be that difficult to ask veterinarians who don't have dental radiographs to basically just let the client know when they come in for a dental that this isn't something that we have the availability to do, but we can still do the dental. There are places that do have that. Similar to when I think places that don't have staff overnight but still house animals on fluids, I believe there's a sign that needs to be posted, and the client needs to be informed of that. And it seems like a very similar type of a situation where it may not be ideal to not have staff overnight, but clients can't afford to go to an emergency hospital or something like that, and so they choose to take that risk, but they need to be informed of it. So, it sounds like that's what you're trying to do, is have something where clients are going to be informed.
Yes, in exactly that, what you just phrased and what Dr. Nunez has described. It was, for those of you who were present yesterday, and excuse me, anybody who watched the webcast, it was a personal example. And I think the other quandary that I think about, protecting the pet, giving the owner clear and accurate information. But the way the situation is right now, I describe it as we're kind of at, let's say 50%, give or take a few percentage points, of places that have dental radiographs. Well, presumably, if you have dental radiographs, you believe in them. Having said that, one of the members on the committee yesterday, who owns a practice, who has dental radiographs, voted against it. So it's not a black and white issue. I totally understand that. But I think the other thing to consider is if you're the veterinarian in the exam room and you don't, in this example, have intraoral radiographs, it isn't necessarily because you don't believe in them or don't want them or don't think they're a good thing. You may be working in a facility where you don't have that control, or finances are such that you just aren't able to purchase the machinery at that point, or do the training, or whatever the example. And so the example that Dr. Nunez described at the level of enforcement, the people that are expert witnesses aren't usually going to be board-certified dental veterinarians. They're going to be expert witnesses that are general practitioners, but they're going to recognize the difference between doing the work without RADs and doing it with. So it sort of leaves the veterinarian in the exam room with the knowledge, him or herself, but
Okay, I think we're getting a nod from Tara here.
in kind of a fix, doesn't really know what to say.
It sounds to me like we need to take a look at this, research it a little bit, and bring it back to the board at the next meeting. What I would suggest is, if the board would like, I could take a look at Section 2032.1, Veterinary and Client-Patient Relationship. I'm looking at subsection B3. Right now, it says the veterinarian has assumed responsibility for making medical judgments regarding the health of the animal and has communicated with the client a course of treatment appropriate to the circumstance. Perhaps we could make that a little bit more clear and clarified as to exactly what the client needs to be told, whether or not they want to or need to do types of x-rays, and then potentially receiving informed consent by changing this regulation. So what I would suggest, if the board wants, I can just take a look at that regulation to see if we could flesh it out a little bit to address these issues and bring it back to the January meeting.
Dr. Nunez.
I have a recommendation. The MDC still does have a complaint audit review committee.
Correct.
I wonder if we can specifically task the complaint audit review this issue on minimum standards versus standard of cares in regards to dental radiography.
Was that a motion?
Yes, it is.
First, we need to find out they even have that capability.
That might be a little challenging. We can see if we can pull that data, because that's, first, they only review disciplinary actions that are taken, so they don't review any pending complaints or complaints that were closed with
It's
no
all
action.
closed cases, yeah.
So, but it's only closed disciplinary cases that they
Right.
look at. I don't know, as far as the data is concerned, if they look at, if we have the ability to pull specific to that topic, but we can certainly research it and do our best to make sure that that's something that we can do. Otherwise, it would be just us pulling all the disciplinary cases we've ever done to try to figure out if it was specific.
You have time
So,
to do that.
yeah, I mean, we have all the time in the world, but offhand, I don't think we have the capability to pull by that specific allegation, because it would result in an accusation or decisions that involve negligence and incompetence. So then we would have to pull all of those cases to
Yeah.
look through them.
I understand.
You know what I'm saying?
Another example of Breeze disappointed me.
Breeze is only doing what we designed it to do, and we didn't design it to do that.
Maybe you could have keywords.
'Cause I actually think we've talked about this before with MDC on that review, because we talked about whether these cases were coded certain ways where you could analyze the enforcement cases by certain specific issues, and I think
So can
the
I
answer
amend my
was
motion
no.
to, if we have the ability to do so, I would like for it to be tasked to the Complaint Audit Committee of the MDC?
You can make a motion.
I so moved.
Is there a second?
I would second that. In fact, I asked that question at our last meeting, as Kathy's reminding everyone, and was told that we did not have the capability. So that was the last response. I would second that motion.
Okay, any other discussion?
Can we clarify what the motion is?
To task to the Complaint Audit Committee of the MDC to investigate or to research the issue of minimum standards on dental radiography versus standard of care, and how that is, or the outcomes of complaints and discipline.
Thank you.
If we have that capability.
Yes.
Any other discussion? Any public comment?
I'm not sure if it's directly to this motion. It's, if you want me to make it now or after, I'm fine waiting until after. It's about this general discussion that you're having. And would you like me to?
It's- Let's vote on the motion then.
All right. Ms. Bowler,
Aye.
Dr. Bradbury,
Aye.
Ms. Laredo,
Yes.
Ms. Mancuso, Ms. Mancuso,
Yes, fine. And Alana had to step away.
okay. Dr. Nolan,
Yes.
Dr. Nunez,
Yes.
Ms. Yanis has stepped away. Dr. Waterhouse,
Yes.
motion carries. Continue the discussion.
Do we want to talk about informed consent? Having Tara,
Oh,
do you want to continue that part?
I think that Tara had said that she was going to give us do some legal research and report back to us on
So,
informed consent.
we need
Isn't
a
that what
motion
you
for
said
that?
you would do?
You offered that, yeah.
I offered to do that. If it's the board's pleasure, I will.
You want to move?
It is my pleasure that you do so.
And it's my pleasure to second that.
Is that a motion?
Yes.
In a second.
In a second? Any other discussion on informed consent? Any public comment?
Not on this specific, it's kind of tacking off from what I was
You don't want to comment on the
so
pleasure of the board?
I'm fine with you guys discussing informed consent.
Tara?
Okay, so I'd like to clarify the motion for the record. It is to assign to legal counsel researching section 2032.1 of the California Code of Regulations in general, but specifically subsection B3 to flesh out for clarification client-informed consent.
Yes, Dr.
I'm
Nolan?
assuming you'll look at other parts of the reg to see if anything else is relative to that?
Yes, I will.
It's like the Mueller investigation is what it is.
Okay, call for the vote?
Ms. Bowler,
Aye.
Dr. Bradbury,
Aye.
Ms. Laredo,
Yes.
Ms. Mancuso, Ms. Mancuso,
Yes, I had to take you off mute. Sorry, there's a delay.
Dr. Nolan,
Yes.
Dr. Nunez,
Yes.
Ms. Yanis, Dr. Waterhouse.
Yes.
Motion carries.
Okay, Doctor, you would like to continue, Dr. Pollard? Or do
He was
you
going
want?
to defer to me, that, I don't know. I don't know
Okay,
if this,
go
I'm going
ahead,
to move on to something different if you want
Yes,
to talk
so-
about dental.
so Ken Pulowski with CVMA. Thank you, and welcome Dr. Bradbury to
Thank
this
you.
esteemed board. So I just caution you, I mean, I think it's great, look at the informed consent. I'm sure most veterinarians could do, a better job. We can always look at improving our communication. We all know that the practice of veterinary medicine is much art as it is science, and a large part of that art is how we communicate with the clients. That is incumbent on who the veterinarian is and what they do. We need to be careful about how prescriptive we are becoming in dictating how a veterinarian practices, excuse me, and what they're required to post and say and do at every step of the way. And now we're discussing, we have to let them know. So I had dental radiography. I performed dental radiography and advocated for it. Not all of my clients could, and I would actually say that many of them were often surprised that we did have that capability. So I would argue that not all clients think that we are automatically providing them, because it's something they have to pay for, and that's something else that we have to discuss. Those are often the biggest challenges, is trying to get the compliance to pay for the diagnostics. But if we go and we start having to say, for those veterinarians that don't have that capability, well, I recommend that we do a dental cleaning and a cohat. However, we do not have dental radiographs at this place. What's the next step? Again, I brought up the example yesterday. So a dog has hematuria, blood in the urine. Do we have to say, well, I recommend that we perform a urinalysis. However, I need to let you know that I do not have an ultrasound available to guide me in doing that and to check for the possibility of stones in there. When I'm going to run blood work, do I have to inform them? Well, I recommend that we run some blood work. I do not have the ability to run electrolytes on the machines that I have in my house. I have a dog with a painful back or a painful neck. I'm going to take radiographs. However, I do not have a CT or MRI at my disposal right here. Where we go, how far do we take this? I mean, that's incumbent upon the veterinarian working with that client and that patient to determine the best course of treatment. And if they feel that it's above what they can offer at that point, then yes, it's their responsibility to inform the client and let them know that perhaps they should take them somewhere else. So we just need to be careful how far down this road we're going to go, how prescriptive we're going to get, because that takes away from what the practice of medicine is.
It does become a philosophical question. So now if, according to the surveys, that 50% of veterinarians are doing dental rads, do we start, and the board is required or does have responsibility for dictating what equipment is minimum, because we now, 50, 60 years ago, however long it was, this board was debating about whether to require a regular x-ray machine, whether to require an autoclave to sterilize instruments. And so it does become a philosophical question. Do we wait until 80% of veterinarians have intraoral dental rads, or do we do it when 60% have? So I don't know. It's a philosophical question, but we're going to leave it at that for today.
Yeah, that's how I left it at, or how we left it at, not when, but if. And there probably isn't going to be I think what I would be concerned about also is it's always better to prevent than go back and repair or bury. And, I mean, there clearly are injuries and unintended consequences happening. Anyway, I think the other thing I'd like to add before moving on to the next agenda item is, while the example that Dr. Pulowski is accurate, ultrasound would inform even a cystocentesis for that case of hematuria. CT would give better resolution than radiograph, and MRI better for certain things. There is a common sense element to this, and there is kind of a more black and white than gray line for some things. And the big differentiation in this case, I believe, is that you do not know many times that you need dental x-rays until you have the pet under anesthesia. And so you've already committed. You have to make a case. And that's not a no-starter. There are veterinary dentists I've communicated with who plan a 2 anesthetic event. And that's okay. I mean, that's not wrong in any stretch. But it clearly would be wrong in my mind if it wasn't communicated to the owner, of course. So I would say the intraoral dental radiographs under anesthesia does differ from ultrasound, other X-ray, pre-anesthetic blood work, pick your diagnostic. Last agenda item discussed was pet ambulances. The subcommittee of Christy Pulowski and Stuart Ekman did a good job. They approached the topic, they said, from one, the consumer point of view, and the other, the Veterinary Medical Board's perspective. And they concluded, I don't know if it's in your packet, but it will be, at least on the webcast, a elencation of the regulations that apply. Legal counsel indicated that she would weigh in on tightening up the language, but the consensus was that current statutes and regulations that are presently in place do apply. And I think we discussed at the last meeting, reported by Dr. Sullivan, about the FAQ, I don't know if it's up, but that the VMB would put on the website informing the public about these issues.
Does Tara have a comment?
No, I think right now, if the members would like to discuss whether or not further action needs to be taken on the issue of pet ambulances, you could discuss that. Otherwise, the frequently asked questions coming out of the MDC will be available for the board's review and deliberation at the January meeting.
Yes, Jessica.
Also, one point of clarification as well. During the MDC meeting, there was discussions, yes, I had said, and I believe Tara had agreed, that the current statutes and regulations do apply to those pet ambulances. I think the question now, though, is should the pet ambulances be required to meet the mobile clinic standards in regulation? There were some comments from members of the public and from Dr. Nunez, and as far as whether or not they should have to have everything that a mobile clinic has. So that could be a potential conversation for the MDC to discuss at a future meeting.
Dr. Nunez, I know
Okay,
this
so,
is a topic near and
so
dear to your
I mean,
heart.
this is an unusual topic because it's kind of a big city issue. It's kind of an issue that is mostly happening in Los Angeles and San Francisco. And there are, just with the number of hospitals and the number of pets and consumers that are demanding a higher and higher level of medicine, I do think that there is a difference between a mobile practice and an ambulatory service, and perhaps even a necessity for ambulatory services in large metropolitan communities. And it's already happening. There are already pet ambulances out there. They start out as being a pet taxi service, which is basically an Uber for animals, taking a pet from a home to a veterinary facility. But some of these taxis are also advertising to the consumer that they have the ability to provide medical care and support to the pet during transport, such as providing oxygen and sometimes even actual medications. And it would seem that these services are not being operated by a veterinarian and therefore are practicing veterinary medicine without a license. To assume that these ambulances should fall under mobile facilities. In Los Angeles, if you call a mobile veterinarian to come see your pet, they would probably tell you, we can come see your pet next Tuesday at 3 o'clock because they just don't have the ability to respond in a way a 911 call would respond. So I do think this is unlicensed activity, and in the past, this board responds to only complaint-driven concerns and does not take a proactive role in preventing potential harm to the consumer and the consumer's pets. So I would love to see a more active role in pursuing these cases of unlicensed activity, and I would even think that we should raise the possibility of somehow incorporating it into a separate practice type of medicine. There has to be some sort of veterinarian responsible for it, but in an example of my hospital, which is not 24 hours, if I do have a patient in heart failure that requires oxygen therapy, which I have the ability to do in my hospital, but at the end of the day, I need to transfer the patient to a 24-hour facility for a continuation of care. My only option would be to turn the oxygen off and call the client and say, get it to the specialty hospital as soon as you can, and hopefully it survives, which is not a great option that I have, but that's my only option at this point.
Okay. Kathy?
I agree with Mark in terms of I hate waiting till there's a complaint or a problem as a board to deal with unlicensed activity, and some of this clearly as advertised may be unlicensed activity. I have not seen any of the ads, but I don't know what we can do. Our FAQ will help, and hopefully public notice will help, but I'm not sure legally what we can do here at this point. I'm looking to Tara.
We don't have to wait for complaints. We can.
Correct. I was
Right.
going to make that clarification. We do not have to wait
I mean,
for
if,
complaints.
right, unless,
We can do internal investigations.
right.
Can I ask a question? I have used these ambulances in Orange County, and the veterinary hospital actually recommended which one to use. So my question to Mark is, why do you not have an option, and why is the only way to go pulling the animal off oxygen and telling the client to hurry up and get there? Why don't you have this alternative ambulance to be able to use? I see them as something different than obviously a mobile vet, but they need to be regulated, and there needs to be some kind of standards, and it just can't be anybody just doing it and putting your life in their hands. But Mark, can you answer that for me?
Well, I drive a Ford Edge, and it has lots of options in it, but delivery of oxygen is not one of them. There's no way for me to transport a pet on oxygen from my hospital to a specialty hospital.
Oh, okay, because the ambulance I use does have an oxygen tank in the back of the pickup truck.
Yes,
and
Judy.
that
Okay.
is exactly what it's used for.
Okay, Tara.
I want to ask Dr. Nunez one clarifying question. You said that perhaps the board needs to explore whether pet ambulances needs to be a practice type. And I want to be careful in this description here because, as we know, practice means action, and a location, perhaps a mobile unit.
I realize all the complications
Okay,
in that.
so-
I do.
So I think we can probably all agree that the practice that's going on in the mobile unit, it should be provided by individuals who are registered with the board or supervised as appropriate by a veterinarian under the Practice Act. But what I would like to suggest is referring this issue back to the MDC for determination and recommendation on whether the minimum facility standards under California Code of Regulations, Section 2030.2, which is relative to small animal mobile clinics, are appropriate for application to pet ambulances? And
Okay.
if so, whether that section should be clarified to specifically add the term pet ambulance to that CCR section?
I guess I'd also like to remind the board that we're slowly creeping onto this issue when we are allowing the emergency transport of animals in one of those pieces of legislation. I don't remember what the actual number was, but we are allowing emergency transport by EMT professionals.
1305, SB 1305.
Which those ambulances are covered under, I believe, the Health and Safety Code. Or,
So maybe pet ambulances could be covered under them.
I don't think so, because the Health and Safety Code, those provisions are regulated by a different agency. So
If you dream it, it can happen.
Okay. So Tara has a suggestion here. Anybody want to make a motion?
The motion is to refer to the MDC committee
Is that Tara?
on if the practice type of small animal mobile practice can be expanded to include pet ambulances. Is that the motion?
yes, to be clear, it would be a motion to refer the issue of pet ambulances back to the MDC for determination and recommendation on whether the minimum facility standards under CCR Section 2030.2 Small Animal Mobile Clinic are appropriate for application to pet ambulances, and if so, whether the section should be clarified to specifically add the term pet ambulance to that CCR section.
Jennifer?
And also, one thing I have in my notes from our lengthy discussion yesterday is I don't think we even have a definition of pet ambulance anywhere, so we need to keep that in mind when.
I make that motion that Tara just made.
Is there a second? Kathy seconds. Any other discussion from the
Second.
board? Okay.
Oh,
Cat-
did somebody have a second?
Yes, Judy.
I'll add to discussion that I learned the term ambulette yesterday.
Ambulette, yes.
Which is an ambulance without lights, I think.
Any discussion from the board, or from the public? You'll call for the vote?
Ms. Bowler? Dr. Bradbury?
Aye.
Ms. Laredo?
Yes.
Ms. Mancuso?
Yes.
Dr. Noland?
Yes.
Dr. Nunez?
Yes.
Ms. Yanis?
Yes.
Dr. Waterhouse?
Yes.
Motion carries.
Okay,
Well, that's all I have.
are we done?
Looks like the MDC won't be out of a job anytime soon. Thank you.
Yes, and we haven't even got to marijuana yet.
All right, I just wanted to thank Dr. Pollard and make sure that we all recognize him. For those of you in the
Yes.
executive positions and who will serve in the executive positions, I'm sure you know this is a very thankless job. And the chair of the MDC has to wrangle the conversation, keep everyone on track, and he has to diplomatically sit there and defend decisions that he may not have voted to support. So we all appreciate you, Dr. Pollard, and thank you so much.
Yes, thank you, Doctor.
I second that highly. Yes, thank you.
With pleasure.
Okay, how we doing? Anybody need a bathroom break? Yes, okay, we're going to take a 5-minute bathroom break. Moving on to agenda item number 8, we're going to do 8A, status of pending regulations, and Amanda's going to run us through this.
Okay, so there's a couple of items under tab 8A. The first one is the status of pending regulations. So there's quite a few changes since the last board meeting. The first one, fee schedule, it has moved. It was noticed by OAL on the 12th, and it is at the 45-day comment period now. That'll close on the 26th. And we're going to talk more about the specific comments received to date later. So this is an emergency regulatory package. So we are able to file 2 extensions. I did file the second extension on the 16th of October, and so that gives us until March 5th of 2019 to have it through the final process. CPI has moved. I got updated that it is now with agency for review, and the next step for that is it will be noticed with OAL. And then the only other changes outside of that is, at the last board meeting, it was voted on for me to start working on animal physical rehab and drug compounding. I have actively started working on both, and so I'm working with both Ethan and Tara to get those up and running. So animal rehab, RVT, education, disciplinary guidelines, and drug compounding, I'm all actively working on right now for submission to DCA. And then the other documents that are under that section, this is a document we submit every year to OAL, and it's a tool that OAL uses where we can provide them with the workload that they expect us to submit to them. So this is what we send them as a courtesy to say this is what we anticipate to submit to you for notice in 2019. So if you look at the second page there, I have all the ones I'm actively working on, including the uniform standards for substance abuse. So this is just a courtesy to them. And I believe this is something that Jessica and I talked about the board potentially voting on to submit to them as well.
This is a requirement by law that we provide this calendar, and so we'd like the board's motion to approve the calendar. This also gives a good idea of where we fall as far as regulations are concerned, and so if there are some pending rulemaking packets that the board feels is more important than the other, then now is a chance to say so, because we can move it up in priority on the calendar.
We submit the, and by the calendar, you're referring to these pages with colored boxes?
It's the black and white ones.
Or the black and white one?
Yeah.
Okay.
It's a 2019 rulemaking calendar.
So there's specific dates on when we will, when OAL can anticipate
Yeah.
seeing our regulations. And
Yeah.
so that gives you a good idea of the time frame for the rulemaking packets.
Okay.
Okay, and rehab's not on this one, on the calendar?
Should be. Did I miss that one?
Which one did you say?
That was just an oversight. It should be there. So animal rehab should be on there. I anticipate to send all the ones I'm working on plus the uniform standards, which is what I had planned on working on next as long as the board would like me to continue on that path.
The pages with the colored boxes look like a board game. A very boring
like
board
it.
game, but
I want to
Like
see,
the graphic.
It is a
that's
board
good. I
game.
want to see the yellows move forward.
Yeah.
Okay, Tara had a question or statement?
I just want to bring to the board's attention that the animal physical rehab language contains the term range setting, which is currently being discussed and deliberated on at the MDC level with respect to shelter minimum standards. So I'm wondering if the board would like to delay the rulemaking on APR just to address, or at least to conform, the range-setting language to what is being pondered for shelter medicine and minimum standards. I just want to bring that up because it seems to be
Any comment from the board? I would say no.
I don't think we should delay it.
Dr. Nolan?
I think that would be a very bad idea to delay it. I think we can discuss one term at some point, but I think we need to press forward. We do due diligence to this, honestly.
And I think those are two different things. The range setting for APR is different than herd health that they were talking about for the minimum standards.
the board could move forward with APR, and then if a change needs to be made later, you could always just change range setting to whatever the new standard might be if it changes.
We okay with that, or you need a motion?
No motion necessary.
Okay, good. We need a motion to accept the calendar, though?
Correct, and since the physical rehab is not, I'm sorry, animal physical rehab is not on the rulemaking calendar, and we will add it, where would the board like to place it on the calendar? Because they are different dates, and I'd like to make sure that what we submit to OAL effectively captures the priorities of the board.
And
Is it,
so, how is this?
is the way, is it ordered in the?
Yeah, how does this work?
So
Are
if you
there
look at
dates?
the projected dates to the, so for example, on the schedule of fees, right there, it's on the right-hand side. There's a projected date for it to be noticed. For example, I put that one as 10/12 because that was when it was noticed. So currently, right now, animal rehab is around the same timeline as drug compounding in terms of how far
Okay.
I've gotten with it.
So this is in chronological order right now?
Yes, it should be.
So it's, so, but again, what you just said, I'm sorry, was that it's
So-
about the same level as drug compounding?
Yeah, so
Not
disciplinary
telemedicine?
guidelines and RVT education are further along than animal rehab and drug compounding. So I can always bump drug compounding, or, animal rehab up, but if we're keeping it in line with where it's currently at, it would fall around the same timeline as the drug compounding.
I think we should bump it up.
Yeah,
I think
I would
we'll
make a
bump it up
motion
too.
to bump it up to telemedicine or
would be at the telemedicine
before
level?
telemedicine and behind the CPEI.
So telemedicine's already been submitted to DCA, so I couldn't push it up any further,
Okay.
but, so animal rehab is on the online one. I think the board packet one is just outdated. So currently, right now, I have it as a projected notice to OAL is April 2019. So if we bumped it up further,
To there.
so telemedicine's already with DCA, so it couldn't go before DCA. So if I finished it, I could potentially get that submitted at the end of the year. So I could get that one potentially submitted January, if the board is okay.
So
it
would that go
wouldn't be-
between telemedicine and veterinary tech education?
Yes.
if that's okay.
Okay, any other comments? Is there a motion? Yes.
I would make a motion that we put, that you bump up animal rehabilitation timeline so that it fits between telemedicine and veterinary technician education on your calendar.
And otherwise, that motion would be to approve the rulemaking calendar with that edit.
Yes.
Okay.
Is there a second?
I'll second it.
Dr. Nunez seconds. Any other discussion from the board? Any comments from the public? No call for the vote?
Ms. Bowler?
Aye.
Dr. Bradbury?
Aye.
Ms. Laredo?
Yes.
Ms. Mancuso?
Yes,
Dr. Noland?
Yes.
Dr. Nunez?
Yes.
Ms. Yanis?
yes,
Dr. Waterhouse?
Yes.
Motion carries.
Okay, now we're going to change the order, and we're going to go to 8D next, which is the disciplinary guidelines. And depending on how far we get through this, we may have to put off some of the other items until January. But anyway, 8D, disciplinary guidelines. Okay, so do you want, okay, what's the pleasure of the board? You want to break for lunch now? Or do you want to start on these? Lunch is not here yet? No. Okay, I guess that settles it.
can I ask a question? What time were you gonna do cases?
At 3 PM is our plan.
Okay.
So Tara, do you want to speak first?
Sure. Okay, so we've got disciplinary guidelines before you once again. This is to make some more substantive changes to the disciplinary guidelines. We're adding some appropriate reference sections to the actual proposed language. So I guess this would be page 3 in your packet. At the top, it says proposed language specifically to section 2006 disciplinary guidelines. We're just updating the date as to whether, what we presume the date will be if the board adopts this today. So we're updating that to November 2018 as the date attached to the disciplinary guidelines, and we're adding some relevant code sections here. I've got a couple comments to the side just to let you know what the code sections are that we're adding. Any questions on that? So on the first page of the disciplinary guidelines, there's just minor and technical changes there to update for new information. That's the same with the next page, which lists everyone from the Veterinary Medical Board. And indicating a couple staff changes as well.
Yeah, so I see that our new enforcement officer, this is how we're introduced to our new enforcement officer, and I already asked, he's not related to George.
Okay, so the next page is the table of contents. The first comment here, I'm requesting the board to strike business and professions code sections from the disciplinary guidelines, as it really doesn't make sense to have this list of regulations, cite and fine, misdemeanor citation. This is all on the next page. You'll see this B&P code sections list I'm talking about. I think you should just delete that entire page as irrelevant.
So where does I was confused, where does the table of contents start then?
The table of contents is it's the page right after the board member name list.
Right, but if you're striking the business professional code sections.
Right,
And then your letter says, and strike this page 4 as it is. I don't understand what that means, and strike this page 4. What are you referring to there?
Strike, yeah, it's the next page. So you have the table of contents, and then the next page, I'm recommending that you strike that language.
Okay, so all of these other things, penalties by provision, that's remaining.
Yes.
Okay.
So the rest of the table of contents, we're just adding appropriate references to code sections.
Okay.
So it's really just kind of, it's going to be more informative for ALJs and the Attorney General's office and the public and licensees as to where they can find potential violations by the code sections. So turning to the next page, this California Code of Regulations page, does anyone have any comment as to whether or not to delete this page? Okay, I'll move on. So now I'm on the page 1 at the bottom. It's Disciplinary Guidelines Introduction. Much of this you've seen before, but there is a provision on the bottom of this introduction that we're requesting to add to clarify the board's communication policy with respondents who are on discipline, but that communication that occurs after the decision has been made final. We're suggesting this language because it's become more difficult for board staff to figure out which attorneys they're supposed to be sending disciplinary information to on behalf of the respondent. Are they supposed to send it to the respondent and the attorney, or just the attorney, or just the respondent? So for board efficiency's sake, and this is really a restatement of what most of the other boards are already doing, that and it clarifies here, I'm just going to read it. A respondent may be represented by private counsel during enforcement proceedings and up to the entry of the final disciplinary order. And what that means is if the board's decision is subsequently challenged at the Superior Court level, it is not a final decision at that point. Once the court has ruled and it's gone back to the board and there are no more challenges on that decision, that's when it becomes a final decision. And that's the end date as to whether the board would continue to respond to or communicate directly with respondents' counsel. Once that final decision is entered, at that point, the board would just be sending relevant probation information and other discipline communications to the respondent only.
And could you point out where that's also reflected on page 14? Because I didn't see that, I didn't see that exact language on page 14.
Under what provision?
Well, it says on your cover letter, proposed disciplinary guidelines, page 1, introduction, semicolon, page 14, standard terms and conditions of probation. So I do see it on page 1, introduction, but I don't see it on page 14, standard terms and conditions.
It's actually on page 15, condition 4, cooperation with board staff.
Okay, there it is.
And back to page 1, the last sentence, can I suggest a wording change, a grammar change, so that it would read, board staff will communicate directly only with respondent. So move only with respondent.
Well, actually, I'm sorry to go back. Page 15, it doesn't say that. The introduction says that once a final decision is made, then the board communicates directly to the respondent. And then page 15 says that in regards to investigations, so that's not referring to final decision.
It's the
referring to
next sentence.
investigation.
On page 15, item 4, second line down, at the end of that line, it says, "The board will communicate directly with respondent, and respondent shall communicate directly with the board."
Is that after the decision is final?
Yes, because probation conditions are only effective once probation is effective, so you already have a final
Okay.
decision.
Okay, I get it.
Okay, okay, yes, public comment?
Thank you. My only concern with this section was how you define communication. So are you talking about communication just back and forth mailing type of communication? What if a respondent wanted their attorney present to communicate verbally if they didn't understand something? Would that be no longer okay under this section?
Well, that would be up to the respondent if they wanted their attorney present during those communications. Like, say, there's the introductory probation conference. Yeah, that's fine. It's more about, because the board staff would still be communicating directly with the respondent, but the board staff would not be required to communicate only with the attorney and not the respondent, or both. And it is primarily in terms of written communications, where respondents want their attorneys to get all the paperwork, and board staff shouldn't be responsible for determining whether or not the attorney is still retained on behalf of the respondent. So it is primarily written communications to and from the respondent, or at this point, petitioner, or probationer and board staff, and then interviews. So, those oral communications, it is about direct communication with the respondent/probationer. If the attorney is present, that's not going to be a problem, because communicating that information to both of them is the same as just communicating it to the respondent. It's not an additional step to communicate it to the respondent and separately to the attorney. It's that separate communication that we need to resolve.
I just wondered if there was a way to clarify it further. When I read it, I felt like it was saying that you couldn't have your attorney present, and all communication would exclude the attorney, and I'm not sure that would be good. Not that they need to have their attorney with them at all times, but it felt like this was more about written communication, and I totally get one address and all of that, but the word communication could be pretty broad. So, thank you.
Yeah, I have a question.
Yes, Dr. Bradbury.
Yeah, the way that it sounds here to me also sounds like even if the attorney was present, they wouldn't be able to like ask questions or directly.
So are you talking about page 15?
Yeah.
Okay, well, we'll get there.
Okay.
Well,
Okay,
could
Kathy.
so right now, I gather that obviously the respondent is always communicated with, but it's a case-by-case basis whether the respondent wants their attorney to be in addition. Obviously, the respondent's the primary and in person communicated with by our staff post-decision on all probationary things. Is that correct?
Yeah, that's definitely the intent. The board should be communicating with the licensee or the probationer, not trying to figure out if the attorney is still representing. Yeah.
Right. And that's, I assume what happened, I'm just saying, that's what happens now, and only the respondent can also say, will you please also add my attorney to the...
Yeah, today that's happening. What we're getting is communications from the attorney, and we're not sure whether or not the attorney is still representing the individual. And then it's a matter of processing paperwork. Okay, well, for us to continue to talk to you, attorney, post-decision, because you're now technically not representing the licensee in any open matter, we're requiring consent forms signed by the respondent to be submitted to the board staff to allow the board to communicate otherwise confidential information to a third party, even though it is the attorney. At this point, they're a third party. So it's this, additional paperwork and confusion, how long that consent lasts. Is it over, the entire probation period? Is it less than that? So yeah, that process today has been very difficult and confusing, unnecessarily so. So we're just trying to make everyone aware, primarily the respondents, that they are required to communicate directly with the board and not through their attorney.
Dr. Nunez.
I think I realized, I think Tara introduced these changes because it's what all the other boards are doing. I think that's what I heard her say in her introduction. But to Val's point, after a final decision is made, there are some examples where the decision says the level of discipline is to be determined by the board, or the amount of drug testing is to be determined by the board. So I do think that there probably are some instances where even though the decision has already been made and finalized, a respondent may wish to have their attorney present to clarify the conditions of the discipline. So is this, by this language, is this going to be in any way restrictive to the respondent having ability to have legal counsel, even though the decision has already been made?
That's not the intent to exclude the attorney. The intent is to just have more direct contact with a probationer.
So is there confusion that once the decision is made, then as in the eyes of the board, the respondent is no longer being represented by the attorney?
That is the position. they're no longer represented by
Case is
counsel
closed.
because there's not an open matter anymore.
Yeah.
So effectively, if they want an individual sitting with them to help them through the process, they can do that. Primarily, we're assuming that would be their attorney. This doesn't exclude the attorney from communications, but it does require the respondent's direct participation in the communication. That's the goal. That it's no longer just a board staff with attorney communication.
And why is that beneficial for the board?
It's beneficial for the board because it cuts down on time and paperwork. It becomes very confusing if the staff is trying to figure out, okay, they had an attorney at one point, we were only sending stuff to them, to the attorney, and now we need to communicate directly with a probationer. We don't need board staff trying to figure out if they fired that attorney, if they're still paying for their services. Do they actually want the attorney getting this stuff outside of a consent form? How long is the consent form for disclosure of information, confidential information to the attorney good for? We don't want to have to continue to go back and update consent forms. At this point, it should just be the board communicating with a probationer.
But it doesn't prohibit the respondent to still retain legal counsel.
Correct.
Okay.
Jessica?
And to go to another good reason why the board needs this, when you look at probation and the relationship between a probationer and the probation monitor, speaking from experience for several years as a probation monitor, there are lots of boards who actually do not allow their counsel in the room for probation meetings. Board of Registered Nursing being one of the biggest ones. And I'm not proposing that, but what I'm saying is the concern, and this has happened, where you take a probationer who is on probation due to substance abuse, for example. And the probation monitor is trying to communicate with that probationer and ask questions for the probationer and is observing behaviors of that probationer. If you get an attorney who is the one who is driving that communication, then if the attorney is the only one responding for that probationer, it becomes a problematic relationship because you don't have that cooperation with the probationer.
Yeah.
And so I believe that's a big reason why the Board of Registered Nursing, who has one of the biggest populations of probationers, do not allow their counsel in the room during those probation orientations or those interviews. I don't know if that's what the board wishes, but I do think that it is important to have that relationship between the probation monitor and the probationer, and still have the counsel can still be involved, but it's respondent's decision to forward communication to their counsel if they wish, and to forward counsel's questions to us if they wish, but it needs to go directly to the probationer and to the monitor from the probationer.
Dr. Nolan had a question.
I think I understand this issue, and I would like to propose a few words to add to this that might clarify this, and it would be following entry of the final order, including but not limited to while the respondent is on probation, probationer may continue to retain private counsel. However, board staff will communicate directly only with respondent, and respondent is required to communicate directly with board staff. Let me read that again.
Now, you're referring to page 15? the
Page
line?
1.
Well, I thought we were still on page 1, but I.
1, yes.
Let me turn back to page 1.
Page 1, we've only got 28 to go.
So I'll read it again. Following entry of the final order, including but not limited to while the respondent is on probation, inserting new words now, probationer may continue to retain private counsel, comma, however, board staff will communicate directly only with respondent, and respondent is required to communicate directly with board staff. It gives the probationer an opportunity to understand that they can still retain their own counsel, but they are responsible for communicating directly with the board.
You like that?
Yeah, I think that works. I just want to make sure that what you're approving today is, we need to clarify whether or not you are okay with the attorney being present in probation meetings, or as the Board of Nursing does, they don't allow the attorney in with the respondent in the probation meetings. I know that there are some attorneys who would argue their participation in those initial probation meetings is really helpful to board staff and the probationer because they're able to communicate these legal terms to the licensees so that there's a better understanding of what is required of the probationer. So there's an argument to be made that having counsel present is helpful for everyone. On the other hand, as Jessica pointed out, there are other reasons that may be more important to keep counsel out of those initial meetings.
Dr. Nunez.
Wow. I mean, I get Jessica's point, especially with the nursing, but is that fair what you just proposed as well, Dr. Nolan? For example, if I'm a respondent who is doesn't have a great grasp of the English language or is very non-confrontational, and I am told by my attorney, don't let them tell you you have to do this, but now I can only communicate with the board, and I don't have the ability to do what my attorney said that I should do, because the restriction now is that the board only communicates with the respondent, and the respondent only communicates with the board. That would be my concern about fairness.
I don't think it
I
restricts
think
it.
my wording was to allow the probationer to actually have their attorney helping them, whether
Then
they're
it- but
present
then
in the
it-
room or
but
not.
in-
And I was
go-
understanding from
Yeah,
what Val
but-
was saying that there, if you read it exactly the way it says, it almost jumps out at you that, oh, you can no longer have legal counsel involved with this. And I don't think that's
I
appropriate.
don't read that. I don't read it that
Well,
way
it
at all.
says board staff will only communicate directly with respondent, and respondent is required to communicate directly with the board. It doesn't mention anything about the ability of having counsel.
Sorry, microphone. When you read it with the preceding sentence, a respondent may be represented by private counsel during enforcement proceedings up to entry of a final disciplinary order. And then it kind of goes right off into, no, you cannot, you have to communicate directly with the board. I would read it that to say, okay, I can no longer involve my legal counsel in this process, which I think is harsh.
Jennifer.
It would be my preference that the council is allowed to be present. I know with, especially speaking from an RVT perspective, law is not my area of expertise, and we've seen cases where the probationer is so nervous they forget their name or they're crying. So there could be things that are missed, and I think it's a disservice to not allow council to be present to explain everything to the probationer.
Kathy.
Yeah, and I don't think Dr. Nolan's language prohibits that at all. In fact, I think it's good because it's clear that the probationer may still retain counsel, and that the onus is on the probationer to utilize that counsel. So I don't think we have any kind of prohibition right now on attorneys being present, do we, at this board? You
Not
mentioned
to-
the nurses do,
Right, not to my knowledge.
and that's not what we're
and
discussing today.
To clarify too, what happens during those orientation meetings is that they're going through the conditions verbatim. Oftentimes, they had counsel representing them up until that point as well. And they go through each condition and ask any questions that they might have. And the probation monitor is learning, and she is relatively new, but also is learning the types of questions that come up. And I think, I don't have so much of a concern of having the attorney present during that meeting, but I think it needs to be clear that the probationer and the probation monitor are the ones having the conversation. And if the probationer needs to consult with their attorney for further clarification, I think that's okay. But I wouldn't want the attorney being the one driving the conversations.
I think what you were
How do we-
saying,
Yes, Dr.
oh
Bradbury.
gosh, I'm sorry.
That's okay.
I'm speaking out of, I'll get used to this. I think what you were saying is kind of what I was concerned about, is that sometimes people are very emotional under these circumstances and/or may not have a good grasp of the English language or understand legalese or any of that. And this language says that basically the attorney cannot be the one asking the questions directly to somebody and communicating directly with the probationer, or that was your concern, right? And
Yeah.
and I understand both sides. I can understand why, because I know attorneys would be very stonewalling, oh, don't answer that, and, and that's really not what you're after, is you want to hear what they have to say and how they're responding. But completely prohibiting an attorney from being able to ask the questions under those circumstances, I think, is concerning as well. So I don't know that there's going to be a great answer to that, but I think most of the time it probably is better to have the respondent be the one communicating. I think I agree with that, but I worry that some people's sort of rights and abilities to have a fair sort of interview would be compromised.
And keep in mind, too, the motive of the probation monitor is to document the compliance and to answer questions that they may have. So that's the whole intent of the probation monitor, is to make sure that they do fully understand the conditions that they have and how they can, what that looks like as far as documentation goes. So I do think that if they have any questions for their attorneys, and if the attorney's there, they can still voice their questions, and the respondent is right there. But again, I still think that it needs to be at least with the respondent in the room and the direct communication.
What % of time do probationers bring an attorney?
That I don't know.
Yes, Dr. Rayberry.
And then if they violate probation, does this all go away and they then can have an attorney?
So there's a process when there is alleged violation of probation, and that would be in the form of either a notice of noncompliance, and then depending on what it is, they may come into compliance quickly. If they don't come into compliance, or if the violation is egregious, then that could warrant a petition to revoke probation. However, during that time, probation is still happening, so you now have two essential different proceedings where you have us pursuing the petition to revoke probation with the administrative law judge in the hearing process. And then at the same time, you will have probation, because probation doesn't just put on pause because they violated something.
And how would this language affect that process?
It would not.
So the part that's going to the administrative law judge, their attorney would then start communicating and handling the communication, but while their probation stuff that they're continuing on would be covered by this language.
Correct. In the administrative process for discipline, if they are represented by counsel, once we file it with the Attorney General's office, then the Deputy Attorney General who's representing the board will communicate directly with the respondent's attorney. So it's attorney to attorney. However, during that time, what I'm saying is there could be overlap with the communication between the probationer and the probation monitor still happening because they're still on probation.
So that could get confusing with this. Where like the attorney's like, we don't want you talking to them anymore, and they're like, they have to.
And that has happened, where you could have a situation where you have probation occurring and you file a petition to revoke probation. And actually, this happened at my last board, where the attorney wanted to direct all communication for the probationer because that petition to revoke was filed. He actually went to court and sued us, and the judge ruled in our favor, deciding that it was the board, because the probationer is still on probation. When it comes to probation monitoring, they'll still communicate directly with the probationer. However, in handling anything related to the petition to revoke, the respondent is still allowed to have the counsel. But they are two separate things, and that's really on the probation monitor to clearly explain the difference between the two.
Yes, Kathy.
I hate to add even more language to this, because I think it's still, it's clear to me, but you could actually add a sentence if we want to make sure of this. Something like, nothing in this language precludes retained private counsel from communicating with the board at the direct request of respondent. However, the main point of contact is always the respondent. Would that satisfy some of the concerns?
It would satisfy me.
It would satisfy, because that's really what
I know what you're trying to add.
it is. I don't, but it adds a lot of language, so.
I had a different approach. I don't want to start adding words that, nothing here will preclude the participation of private counsel, because that's exactly what we're trying to do is, start funneling communication to a single point of contact, which in our minds is the probationer. So what I was thinking of building on Dr. Nolan's language, changing it to, instead of probationer may continue to retain private counsel, instead use respondent may continue to receive the assistance from private counsel, but board staff will communicate directly with respondent. That way, I think it hopefully is a little bit more clear that private counsel could be involved in the oral communications or probation meetings, but the probation monitor would be communicating directly with the respondent. Val has a comment.
So I just have this worry that, you're sitting there with your legal counsel, and then the board staff or whoever's communicating is there, and so then this person, the probationer, gets asked a question, and they ask the legal counsel, then the legal counsel has to give them the answer, and then they can respond. That's almost how I'm reading that, and I know that's not your intent, but I think there's a difference between written communication and discussion and this kind of broad word of all of your communication is going to be with the probationer, and just retaining legal counsel is not the same. That legal counsel could be retained but not actually be allowed to be present with you. So I know I think we're all kind of working toward the same thing, but I think the language is really, really important, because this will be here and other people will read it and they'll interpret it differently. The way I read it is, as I told you before, and I just really feel strongly that licensees need to be represented, but I also understand where you're going with the difficulties of the written communications in particular.
Kathy?
The definition of assistance, I'm trying to figure, is with the action of helping someone with a job or task, or be practical use or help, which I think could encompass speaking on behalf of, right there. I don't know. It's a broad, assistance is a broad term. Because I agree, we don't want a situation where you have to talk to so-and-so, it's a telephone situation. But I think assistance can be applied to that definition.
Dr. Bradbury?
It seems to me like the primary goal when you wrote this was to reduce the workload that is going through the probation department. Am I correct in that? And the secondary goal would be great to be able to have a more direct communication with the respondent. But if we're looking at the primary goal and there's concerns, is there a way to instead make it a financial thing where they're paying for our time in doing this? I know it would completely take away from this, but if they wanted to retain counsel and have us communicate with their counsel, then they pay for our time sort of at a...
So to clarify, there is a probation monitoring fee that they are paying. However, it becomes a resource issue when we have one probation monitor and over 100 probationers. So it's really how they may pay for it, but we have one person to do it.
But a lot of people probably wouldn't want to pay $100 per communication if it's outside of the respondent. Like, you can communicate with me, or like with written communications. I don't know, it's probably outside of
I think they'd
what
have
you'd
to
wanna
hire
do.
another staff member, and that's a whole budget change proposal and
I
have to
see.
go through the.
Okay.
Yes, it's not easy.
Okay.
Yes, Dr. Nolan?
Correct me if I'm wrong, but it seems like the biggest issue is written communication, because the respondent i.e. probationer wants you to send everything to their lawyer, and then, you're getting in this situation where, well, how do we know you're still retaining that lawyer? So could it say written communication, and would that help clarify?
So I do want to clarify that there is an issue if you are in a probation meeting and the attorney is the only one talking. So I do think that there should be still direct communication with the attorney I think it's a conversation where you have 3 people in the room and they're all allowed to talk together. But I think there needs to still be an understanding that at the end of the day, it's the respondent who is communicating with that probation monitor as far as what their understanding of what that condition is.
Okay, so Tara, how do you want to approach this?
I think perhaps what we could do might be beneficial to give me a little bit of time to work on some new language. Maybe we could break for lunch.
Let's break for lunch. We'll come back at 1:30. Sixth time that we've seen these exact same disciplinary guidelines, and I certainly hope this can be the last time. Okay, where are we, Tara?
Okay, so we're still on the introduction page, page 1. I have some new language for your consideration. So in the paragraph underlined at the bottom of page 1, the second sentence would go as follows. Following entry of the final order, including but not limited to, while the respondent is on probation, respondent may receive the assistance of private counsel, but respondent shall communicate directly with board staff. New sentence. Written communications from the board will only be sent to respondent. So the goal with this language is to make sure respondent is participating in oral meetings and sending written communications directly to board staff. And notably, it's no longer phrased that board staff would only communicate with the respondent. So in the event an attorney was present in a probation meeting, the board staff would be able to communicate directly with the attorney present. Because I think ultimately what we're trying to solve here is written communication from the board and where it gets sent. So the limitation on board communication to the respondent would only be limited to written communications. So I'm trying to find a balance here between respondent getting help to understand the terms of their probation, so the attorney could participate in those meetings, but the board isn't continued to be overburdened with paperwork and trying to figure out who gets what, when, where. Does anyone have any comments on that?
I'm good with it.
Yeah.
Yeah.
All right, so the language would read, following entry of the final order, including but not limited to, while the respondent is on probation, respondent may receive the assistance of private counsel, but respondent shall communicate directly with board staff. Written communications from the board will only be sent to respondent. Okay, so if we're all in agreement, I'll move on to the next page.
Are we all in agreement? Oh, thank goodness.
Is this an appropriate time to ask a question about the general introduction?
Mm-hmm.
And this may be just me, but it's unclear to me if these guidelines are probationary term guidelines for new applicants, or it's simply for those that we have judgments created in formal disciplinary actions?
So it applies to all decisions issued by the board, and that includes licensees who may be put on probation, as well as applicants that the board issues the license and puts on probation.
Okay, thank you.
Page 2.
So I know we need to start moving quickly through this stuff, and for most of the next few revisions here, you'll just see that code sections of the Business and Professions Code are being added. Those additions, like if you look on the top of page 2, conviction of a crime substantially related to the qualifications, functions, or duties of veterinary medicine, we're making sure that every licensee, registrant, or permit holder is included in this term. That should be a lot more helpful for deputies, attorney general, when they are filing accusations and statements of interest, statements of information. That way they can see, what applies, which code for each different type of license, as well as the administrative law judges when they're crafting their proposed decisions. So I'm going to skip ahead. If I go too far, please let me know if there's something on a page you would like to discuss.
Can I ask you another question, Tara? I'm assuming that this first section, the violation, the conviction of a crime substantially related to the qualifications, et cetera, this is the one that we seem to always apply to those applicants that have had a prior, for instance, DUI. Is that correct?
Yes.
And it seems to me that I've become more and more hesitant over the years to put a person on probation if their DUI was, let's say, 12 years ago or 15 years ago they apply. So can you tell us what are those the same guidelines for those that have maybe a single offense that was well in their past?
Yeah, so the conviction itself, if it was related to the practice, which may include danger to the public, like a DUI, that would be grounds for discipline, but the board is required to apply rehabilitation criteria to those cases, which includes looking at how much time has passed since the conviction, and what the licensee or applicant has done since that conviction to contribute to the community or the practice itself. So I think those that list of criteria is under CCR Section 2043. But yeah, there's a whole nother layer of analysis.
And so then the minimum might not apply to that if they do have some sort of established rehabilitation efforts?
Correct. So to clarify, when we get a conviction, we look at the regulation to determine if they met the rehabilitation criteria. If we decide that they have met the rehabilitation criteria, we will either issue a license in the case of an application without further disciplinary action or any disciplinary action. Or if it's where they're already licensed and there's a conviction, we look at the rehabilitation criteria to determine whether or not discipline is warranted. If discipline is warranted based on the rehabilitation criteria, then we would consider the disciplinary guidelines after we file an accusation.
And by we, you mean?
So I, as executive officer, and the enforcement team will gather the information, do the analysis of whether or not we feel that they meet the rehabilitation criteria. Then it goes to the Attorney General's office, and a Deputy Attorney General is assigned to the case, and they look at it and decide whether or not they will accept the case, and then move forward. But every decision is ultimately the board's decision, to where you're the final stop. And if you decide based on the information that is available to you that you do not feel that this is warranted, you have the option to not adopt and decide something else or amend it back to an ALJ.
Okay, so I'd like to skip to page 12.
If we have something before then, should we take
Absolutely.
that?
Please let me know if you
Can
have
we
a
go
question
to,
on
the
another
one that says
page.
unprofessional conduct? So
What
it's on
page?
page 4, well, 4 and 5. So unprofessional conduct, I mean, that covers a wide area, and specifically under 1, 2, and 3, it really just talks about substance abuse, but unprofessional conduct can be many things. And so I think under the minimum penalty, we should also include ethics training. If it's something that would be, I think we should have it as an option.
Does anyone have any comment on that, on adding ethics to page 5 in the minimum penalty associated with a violation of BPC section 4883G, 4836.2C, 2 and 3, and 4837C?
So it'd be an option. If we thought ethics was appropriate, then we'd at least have that option.
My,
I think we call it
My
ethics
own-
training in other categories, ethics training.
Yes. Yes, Dr. Nunez.
I mean, my only concern is what you initially said, that unprofessional conduct encompasses so many different things. It's hard to say that ethics training would be warranted if it's going to be an all-encompassing category.
But right now, we don't even have that as an option. I think it should be under optional terms.
But it says
It is, my thought is that it's always optional. This just
No, I think
says
it has
that
to be.
minimum is it has to be included.
Okay, to clarify, on page 5, in the minimum penalty box, it says optional terms and conditions, including but not limited to. So if the particular case warranted ethics training, you could add it.
Right. So
Okay.
so it doesn't have to be a minimum requirement,
But we've got
Correct.
everything else listed. Why don't we list that?
because
Okay.
because when you put it under minimum, that means that you have to have it.
No, because it's under optional. Kathy?
I understand where you're coming from. The only confusion I have is these elements here are a little different than CE training. We have optional CE training in various specific things relevant to the enforcement situation, and ethics is part of the CE, isn't it? Of course. So I like, being not limited to means we can apply any kind of
Right.
additional CE requirements that we want to, right?
Because we throw
I just don't-
we throw ethics training on all the time.
Right, and ethics is a separate probationary term, and then continuing education is its own probationary term.
And to clarify
So-
too, the disciplinary guidelines they aren't all mandated, there are guidelines, and so if we believe something, for example, if we are negotiating a stipulated settlement, and we feel that one of the optional terms should or should not be used, the guidance that would be provided through the memo, either the memo from the Deputy Attorney General or the ALJ, should include why they deviated from the guidelines. And so then the board would have an opportunity to at least hear the rationale from why they deviated and decide whether or not they agree with it. But they can still deviate from what's in here.
And so the judge will be looking at this list, and they won't necessarily delve any deeper.
Is there any drawback to putting ethics training on there?
Okay, so are we in agreement to add ethics to that list?
Well,
Ethics training.
Yes?
the drawback is that if it's there and a judge sees it there, they're going to feel like they need to put it there all the time.
No, not necessarily, because
And if they don't put it there, they have to justify why they don't want to put it there.
that would probably come in the discussion of how they reached the probationary terms. It is included in the proposed decision, why they may or may not have strayed from the minimum standards. And, I'm trying to think of specific cases that would not warrant including ethics training. And that would be like a DUI conviction, which fits under this section, but you probably would not order ethics training for a DUI conviction. Alternatively, if you've got a veterinarian operating a side pharmacy out the back door, that's a violation under number 3 of federal statutes, rules, and regulations. That might be cause to include an ethics training provision in the disciplinary terms.
Is unprofessional conduct just regards to substance abuse?
No.
It's
No,
not.
number 3 is a violation of any federal statute, rule, or regulation, or any of the statutes, rules, or regulations of the state relating or regulating dangerous drugs or controlled substances.
Ken?
Not that I would be opposed to it or anything, but could somebody explain to me exactly what ethics training is? I have yet to go to a CE event that.
There
has
are
ethics-
courses that are offered, like Iowa State University has an ethics course, for instance,
Do they?
online.
Okay. So,
It's something we use not uncommonly in the disciplinary cases.
thank you.
And I guess I'm not sure where we define standard terms and conditions in this document. Is that in the very front?
Very back.
Oh, okay, okay. So would it?
Okay, so are we in agreement to add
Yes,
ethics
okay.
training?
Back to the.
To that list? Okay, now can we jump to page, I should ask myself.
Well, I'm not in agreement, but we can
Okay,
go
are you
on.
in agreement?
No, but we can go on.
I didn't see you raise your hand. You want to talk some more?
No? But we can go on.
Okay, so I'm on page 12.
So by standard terms, you're talking about the standard orders? Is that the same thing? Standard terms and conditions are the standard orders?
No, the standard orders is the introductory language that begins the specific terms of probation. Or the order could discuss revocation or license surrender. It may not include any probation terms. The standard orders are on page 13. And what we've been seeing with a lot of the proposed decisions and stipulated settlements is confusing language in those standard orders because the board issues various types of licenses, registrations, permits, probationary registrations, probationary permits. And we realized we needed to lay it out better for the ALJs and the deputy attorneys general so that they understood, how the issuance of a temporary license works with probation that could last past the term of a temporary license, which is only good for 1 year. It's unusual situations, but situations that exist nonetheless. Starting in January 1, the board will be able to issue probationary veterinary assistant controlled substance permits. Currently, you can only issue a permanent permit, but there's a difference when you order in the disciplinary decision a probationary permit versus ordering a permanent permit. So we needed to provide the language for each of those scenarios.
And Dr. Nolan, the standard terms and conditions start on page 14.
I found them, yeah, okay. I was confused with the standard orders versus standard terms, so I found it.
Okay, so on page 12 at the very bottom, I have a comment here. It says, consider striking this language because the current language lacks clarity and is unnecessary. So what we're hoping to strike is this note at the bottom of section 4836.5, 4837, which says, the Practice Act is very specific on the authorized duties for RVTs that cannot be performed by veterinary controlled substance permit holders. Therefore, these violations are more serious due to their blatant nature. In fact, I think it arguably makes this more confusing because it's highlighting the fact that RVTs can't perform specific duties. So when there's a violation, they're more serious. And yet, all misconduct is serious. So it doesn't really add anything or provide any value. So we're recommending that this note be deleted. Is there any question about that or comment?
Yes, I have a question. I'm a little bit confused as to what the difference would be. What could a veterinary controlled substance permit holder do that an RVT could not? I guess it just lends further credence to the fact it's confusing, but this statement confused me in general.
Yeah. It's not that the VACSP holder can do anything more than an RVT. The point is just that the regulations specify what each can do.
Okay.
There are specific tasks limited or listed in the regulations. But if you'll notice, the violation here is for disciplinary proceedings against veterinarians and RVTs. Basically, it's the instances where a veterinarian is having the VACSP holder do more healthcare tasks than they're actually authorized under the regulation. And so because those tasks are enumerated in the regulation, this note is claiming that those violations are so much more serious because they're specifically detailed in the regulation.
Thank you.
Thank you. Any other comments or questions? So, do you all agree that we can strike this note?
Yes, do we all agree?
Okay, so we've got the standard orders starting on page 13. This is primarily the same as what was included in the board's meeting packet in August. The only change here is to provide for the VACSP probationary permit. So under Senate Bill 1480 that goes into effect January 1, 2019, the board can start issuing these probationary VACSPs. So we just added, what that standard order language needs to look like so that it's clear for the ALJs and DAGs that for the probationary registrations and permits are issued for a specific time period, like RVTs, they can't be issued for longer than 3 years. And it's all about the technicalities here, because for probationary permits and registrations, the actual application for it is going to be denied. The denial of the application is stayed, and the probationary registration or permit is issued. And then we have to specify that upon completion of the probation, that a permanent registration or permit may be issued. So we have to provide the steps to the individual who's being disciplined. You're getting a probationary registration today, and once you complete all of that, we will issue a permanent. That it just clarifies the steps for the probationer. Any questions on that?
So this is allowing us to do what we already can do with RVTs by giving them a probationary license.
Right, yeah. So currently, we can issue a probationary veterinary technician registration, and now we'll be able to issue probationary VACSPs.
And that's accomplished in that little parentheses RVT or VACSP only.
Right. That standard order number 7 will be used for either a probationary registration or a probationary VACSP.
Is that redundant by saying application denied, probationary registration or VACP permit issued? And then parentheses, you say the same thing, RVT, RVA, Do you need both of those? Is that redundant?
Which line?
7. This is the one where you're,
Well, I'm making sure that it's clear that this cannot be used for veterinarian licenses.
a veterinary license is not a registration or a permit. So it's a small point, but I think it's redundant.
For the purpose of administrative law judges or deputy attorney generals who don't know the difference between a permit license and a registration, because I've seen them use it interchangeably, I think the clarification
in
is necessary.
All right.
Any other questions or comments on page 13 or the standard orders? Okay, so the next page I'd like to go over is page 15, standard term and condition number 4, cooperation with board staff. As we discussed with the introduction, if we're limiting the ways a respondent or petitioner is communicating with the board, we need to clarify this second sentence here to conform to what we all just went over to change the language on page 1. So my recommendation here is to add to the second sentence that starts on the second line with, the board will communicate directly with respondent, and respondent shall communicate directly with the board or its agent, and written communications from the board will only be sent to respondent. Does anyone have any comment about that alteration? Alternatively, maybe we could take out the board will communicate directly with respondent, because, I don't want that to be read that if there's a meeting, the board staff's only going to talk to the respondent. Because I think we can get where we need to go with striking the first part of that sentence and just starting at respondent shall communicate directly with the board or its agent, and written communications from the board will only be sent to respondent.
Dr. Bradbury, you'd had a question on this. Is that answered?
It was kind of the both of them together, so yes, thank you.
Any other question or comment on that revision?
I have a question. So Tara, when you're saying or its agent, you're referring to the board having an agent?
Right, that typically means the probation monitor.
Okay.
So there's the board communicates directly with respondent, and respondent communicates directly with the board. And you only crossed out the first one.
Right, so the board will communicate directly with respondent, and we will strike that. So that sentence will now begin with respondent shall communicate directly with the board or its agent, and written communications from the board will only be sent to respondent.
That doesn't solve the problem of the lawyer or the attorneys sending you guys a bunch of paperwork.
I think you crossed out the last.
I think it does, because this requires respondent to communicate directly with the board. So the board is going to receive written documents from the respondent. That's the goal, not receiving the written documents from the attorney.
I don't think it achieved the same effect, because I think you still have that potential of the respondent having to communicate directly with the board in regards to, this is in regards to probation, right?
Right.
If the respondent doesn't have the capability, whether or not that is via language issues or public speaking issues. It doesn't allow the respondent to utilize their legal counsel in the same way that we resolved the introduction. I think we resolved it in the introduction, but I'm not convinced we resolved it in this portion.
Okay, so to get at your point, we could add at the beginning of the second sentence, respondent may continue to retain private counsel. Respondent may receive the assistance of private counsel, but respondent shall communicate directly with the board or its agent, and written communications from the board will only be sent to respondent. Would you like me to read that again?
Yes, please.
Do you, actually, before you do that, can you go back to how it was written in the introduction?
Yeah.
Remind me how we wrote that?
So on page 1, it reads, following entry of the final order, including but not limited to, while the respondent is on probation, respondent may receive the assistance of private counsel, but respondent shall communicate directly with board staff. Written communications from the board will only be sent to respondent.
Okay, so it's the same thing.
Yeah, it's like the same thing, but in one sentence.
Okay, all right.
All right, so I'll read the revision to term number 4 one more time. This is the second sentence of that term beginning on the second line. We're striking the board will communicate directly with respondent and we are inserting respondent may receive the assistance of private counsel, but respondent shall communicate directly with the board or its agent, and written communications from the board will only be sent to respondent.
Okay.
Any other comments or questions?
And then it just goes to the last line of that.
So that's the end of the second sentence. We've resolved that with written communications from the board, and then it would just continue. Respondent shall make available all patient records, et cetera.
So I have a comment about the next paragraph. Are we on that one? Respondent shall claim all certified mail issued by the board respond to all notices of reasonable request timely, in a timely manner. It seems awkward, almost like you wanted to make two, you should make two sentences and.
Jessica, I think this might have been one that you added.
Maybe it's okay, it just seems awkward to me. I would suggest maybe say in a timely manner instead of just timely.
I think that's fine.
I think that's helpful, but I'm not sure I understand the
rest of
first
sentence.
line.
Yeah.
Respondent shall claim all certified mail issued by the board. Respond to all notices of reasonable requests. I'm not sure what that is.
So when you send out these materials, is there usually a deadline in there? If you're requesting something, is there a deadline for when they need to submit it?
Yeah, so it could be.
Is that what they're
It could
saying
be
here?
several things. So when we do communication for certified mail, sometimes the probationers choose not to accept it because we also send regular mail. And then they try to make the claim that they did not receive it, but we did not get the original letter back. As far as the notice of reasonable request timely, if we have a probationer who we have sent a notice of noncompliance and we're requesting them to respond, this makes it so we would put a deadline so that if we give them 14 days, 2 weeks to respond to noncompliance, it wouldn't be in the same day type of response. So we are reasonable with that, but it's also not something where they can continue to delay. So I think it's necessary to say what the expectation is up front in the condition, and then when we were in the orientation, explain further what exactly that means, because it's important that these conditions are held and that they respond to issues of noncompliance timely.
So I would probably take the timely out and then keep on rolling and put in a timely manner at the end of that sentence, because it would refer to both of those issues.
Would it be better to add that actually at the beginning, respond in
Yeah,
a
either
timely
way.
manner?
But I think she wants them to submit reports, identification update reports, or other reports similar in nature as requested and directed by the board, or it's designate in a timely manner as well. Is
Yes,
there
so-
an
so-
expectation of timeliness for both?
Yeah, so typically those reports are basically their information for communication and their preferred method. If they prefer to be called on their cell phone versus email, what their preferred method is all on this identification report, and they want to update it. In the orientation, that's something that we would send them prior to the effective date, and then during the orientation, they would bring that with them. So yeah, I think
Again, it
that's
seems
fine.
like you want them both to correspond in
Yeah.
a timely manner.
I agree.
Or however you want to word it, it just seems like it's a little awkward, this one. Why are you staring at me, Mark?
Because I agree with you.
Oh, okay.
That's fine.
Couldn't read
I
it
think
in
that's
your way.
fine.
I agree with you on that.
So are we trying to require the respondent to respond in a timely manner?
Yes.
Are we also trying to require the board or its designee to respond in a timely manner?
I don't think that was the intent. I mean, obviously, that's,
Okay.
we always want to respond timely, but with, again, one probation monitor to over 100 probationers, I think this was the requirement on the probationer to respond timely.
Okay, so I would prefer to add after, let's see, it would read, respondent shall claim all certified mail issued by the board, comma, respond and add in a timely manner to all notices of reasonable requests. I'm still not sure what reasonable request is. Because a notice is one thing.
Right.
A notice may request information. I'm not sure what that is.
So that could be if we need clarification on a quarterly report, or it's requests for information. And so it could be, if we get a quarterly report and there's a question there from the probation monitor, we would contact that probationer and ask those questions. It could be a response to noncompliance. We ask for additional information there. It could be a myriad of requests, but it's requests for information.
Can we say that instead? So it would say, respond in a timely manner to all notices and requests for information, and submit reports, identification update reports, or other reports similar in nature as requested and directed by the board or its designee.
Are you all happy with that? I have a request for these aging eyes. If you could make this font bigger, and especially the grayed out area, I can barely read.
Denied.
And do it in a timely manner.
In a timely manner.
We can do it right now. We can make it bigger.
Oh, yes, I should just read it there.
That's timely, right?
So I want to go back to the language we're adding in the first paragraph. Right now, we have it as shall communicate directly with the board or its agent. I just want to change agent to designee.
Be consistent.
Yeah, for consistency with the other use of that term. Okay, any questions or comments? So that That's primarily the main substantive changes from the last time you saw this. Although I recognize you didn't discuss it at the last meeting, but it was part of the meeting materials.
I think there's a typo on 67 on page 20.
You have a comment here about new justification.
Oh, I think she's looking at something else right now.
Sorry, I'm looking on page 15, number 6. There's a comment that says need justification for requiring respondent to notify the board when applying for employment.
Yeah, that's what I had a question on.
Do you want to do that? And if so, why?
Oh, there.
Yeah, I don't see a need to notify anyone if they're applying for a job.
Right. I agree.
I did not understand, yeah, that's why I have a big question mark there, too.
So we want to strike applying for employment.
I'm sorry, where
Did
are
we
you?
have that in there before?
So this is on page 15,
Page 15.
new term 6, changes of employment or address. And it's the third line in that paragraph.
Okay, I see it.
So are we okay with striking applying for employment?
Well, do we want to keep employment? Perhaps,
Termination or resignation from employment, change in employment status. So you have all of that.
okay.
It's just applying for.
Right.
Right.
Sorry, just applying for employment that seems odd.
And was that in there before? I'm confused at this point. I don't remember that.
It was in there before, and I was doing a pre-review of the disciplinary guidelines and came across that and couldn't quite understand what the justification might be for adding that.
Other than creating more work for you.
Right. Any more questions on page 15? Or comments? On page 16, notice to employees. We recently had a situation where the probation term was unclear whether or not a veterinarian, I can't remember if it was a vet or a.
It was so I see the need for doing a notice to employees if a veterinarian is employing multiple individuals. I think, though, the question is with some of the orders, if you read those sentences together, there is an interpretation that if a veterinarian is working in an office with colleagues, so not necessarily, they are an employee, and there's other veterinarians in the office, do they then have to go to everybody else who is working within that practice, even though they don't own the practice, to fulfill this requirement? So I need a clarification if that was the intent of the board to require someone who is not an employer to notify every single person that they are practicing with.
What do you think?
I think that's excessive. And then when people come in, like even if a relief vet, or, you have to then hand them something and have them sign it, or if you're just an employee.
Hi, this is Alana. I can't hear anything.
Oh, sorry.
We turn.
Did you hear what Jessica said?
I heard what Jessica said, but I couldn't hear who was speaking after that.
Oh,
Okay.
it's Dr. Bradbury. I was saying that it seems excessive if it's just an employee that's working at a hospital to have to do this because people do come and go, and, I mean, it would be very easy to violate this, and I don't know that it would affect the people that are working there if they're not employing them.
And so the first,
Are we talking about if somebody's on probation, that they tell everybody at their office?
yeah. So that we're on page 16, the new condition number 9, notice to employers. And the first sentence requires that they post or circulate a notice which recites the violations, which I would argue that you would just have the disciplinary orders and not necessarily something else that the probationer would then summarize and recite the violations. But you have, which responded to the discipline and terms and conditions of probation to all licensed, registered, and permanent veterinarian employees, and to any students, residents, and interns involved in his or her practice. And so it says his or her, so the assumption is if they have a practice, it belongs to his or her. And then the second sentence is also possessive to his or her employees. So the question is the intent for the board to only disseminate that to his or her employees if the respondent is an employer, or is the intent for the board to require this circulation and this acknowledgement to all employees in the practice, regardless of whether the respondent is the employer?
This is something that's been going on forever and ever and ever. So, I mean, Ethan, anybody can answer that, and we should just continue what we've been doing forever, it seems to me.
I might not think it's excessive. For an example would be if I'm working at a hospital and I'm not the employer, I only have to know if my employer is on probation, and I don't have to know that my fellow associates are on probation, because I may hand a case over to one of my fellow associates. I don't not necessarily hand the case over to the employer. So I don't think it's excessive. I think that every license holder should know about probation for anybody in the hospital.
Kathy?
Yeah, I was going to say, it was always my understanding, and maybe wrong, but I thought it made sense that everyone was notified, any licensed practitioner in that hospital, if there was a disciplinary order on an employee. Now, the idea of the transactional part of that, I'm not sure how it happened, but I was never thinking was only the owner veterinarian. I thought it was any veterinarian practicing in the hospital had to notify the other folks practicing. That made most sense to me.
I think in the interest of keeping everyone honest, if a relief veterinarian were coming into a practice and there was somebody there who maybe had an accusation of lifting controlled substances, that relief veterinarian wouldn't know to pay attention. And then if there were to be a discrepancy, so I don't think it's excessive either.
So I would request then clarification in that second sentence. If the intent is to have everybody be notified, then to clarify that statement, because it does say his or her employees, which may not be his or her employees.
Correct. Correct.
So this was written when there were smaller hospitals.
Could we add the term employees or colleagues, or in a,
No.
How about associates?
Perhaps we could change in his or her veterinary practice to involved at the veterinary practice.
Any perspectives?
Remove the ownership of the veterinary practice so that it's just everyone working there. I know. It should be the premises,
Yes.
the registered premises.
So, Dr. Bradbury?
So I'm just wondering, like in a 24-hour facility, if there's, for example, multiple relief veterinarians, that's where I work, is in a large practice like that, and somebody's on probation but isn't actually interacting with those people, but maybe, I don't know, goes off shift and the other person is going on shift, are they then required to get a written statement from that veterinarian or technicians that are working sort of peripherally? I think that's the thing that I'm concerned about more, is the violation of this by not getting these written things when there's many people that might be coming through a larger practice.
I do think that could be very problematic, and I think it might be difficult for the probationer to comply with this term.
Yeah.
And, this initially requires here, post or circulate a notice. So the point is to let everyone they're working with know they're on probation, they're being disciplined. Is the requirement to have all of the employees, coworkers, then sign a document acknowledging that they read the accusation and the decision, and then send that into the board? That might be the egregious,
The excessive
overly
part.
burdensome part, yeah.
What happens now?
Yeah, that's my question. Do they do that now?
Yeah.
Yes. That is the interpretation and the direction, is that everybody who's associated will have to send that in writing. And I do think that that's overly burdensome.
And as new people join the practice, they sign, and so you get constant paperwork from these practices where there's a probationer. Is that how it has worked?
Let's hear from Valerie.
So I've always been a little concerned and a little bit confused by this language, and everything you're saying follows suit with that, because it doesn't really start out with in order.
Can't hear her at all. Sorry, it's Judy. We can't hear her at all.
I was saying that I've always been a little concerned and confused about this language, because I think if it started out with the purpose for why it's even being done, it would be helpful. So, because if I signed something like this in a practice, I would be like, okay, what am I supposed to do now? Because I know this. Am I supposed to report something? Am I not supposed to refer something? What is this telling me, and what is the outcome supposed to be? And I also wanted to ask, is this, do the other medical professions have this same type of language in their disciplinary guidelines? Because it always seems like we're creating our own guidelines, and if they are doing it, what are they doing? And if they aren't doing it, why are we doing it? And I just find it a bit confusing as to what the purpose of this is and what the outcome is supposed to be. Thank you.
I don't even know why we're addressing this one. If it's not broke, why are we trying to fix it? This has been going on for years and years. Is there a problem with this so far?
Tara?
Yes, there is a problem. Recently, we saw a disciplinary action of a veterinarian, and this term was included in that disciplinary order, but the individual being disciplined was not the owner of the practice. So how are they supposed to comply, or why would they be required to comply with a provision currently aimed at solely owners of the practice? And if so, yeah, so it's like, it's sitting there, so it's being used, but today it's being used inappropriately, because I don't think the ALJs even know what this is supposed to mean or be aimed at. And so then the next question is then, why is it only owners that have to notify all of their employees? Wouldn't everyone working at the registered veterinary premises want to know that this individual is being disciplined?
Okay, thank you.
To Val's question, obviously, I don't know every board. I can tell you that optometry did not have a notice to employees. We had a notice to employer. But I think with all of these conditions, starting with the why and what we're trying to monitor to achieve successful rehabilitation and documentation, I think is key. And to what Jennifer had stated about, she kind of gave a why for why you would want the others to know, because if someone had been on probation for a drug diversion and you have RVTs, you have VACSPs, people and other veterinarians who are working in that office, do you want them all to know so they can keep an eye out if something happens? I would, though, suggest that I think if any of them see something, whether or not they're on probation, if they have suspicion that they're diverting drugs, I think that they should take the same precautions.
I'd also like to point out that this is a standard term, so it would be included in every disciplinary decision. And yet it really only currently applies to owners of the practice.
Dr. Nolan?
Would it be possible for us to have a template that all employees and associated people could sign that had a blank where they could fill in the violation and the terms of probation, and then that one form is sent in to the board, and then if there are new employees, they could have a separate form, but it just seems really hard to comply. If you're from a big practice, that would be really intimidating and difficult.
So there is a template, but I still think that it is difficult for them, especially if you have turnover and you have RVTs coming in and fill-in vets, and the question is, what are you trying to gain by requiring this?
Well, and you're also putting the onus on the fellow employees. They're supposed to sign it and send it in, whereas you're not having the probationer be responsible for gathering the signatures and sending it in, it seems to me.
So what do you, Tara and Jessica, what do you suggest?
Is there any way we can put language saying that a reasonable attempt should be made to notify all licensees in a practice? Because as it is right now, you're stating that all license holders need to essentially notify the board that they have been made aware. And I know the board's not following. How do you know all the employees and license holders in a particular practice? I can't imagine that the board is doing that. I can't imagine that they are. So I would like all licensee holders to know about disciplinary action taken against fellow licensee holders in a particular practice.
What about the residents or the interns?
But I think the burdensome part comes when the board is asking for documentation that all the license holders have been made aware of it. So my thought is to perhaps have some sort of language that just says that there should be a reasonable attempt for all licensee holders in a practice to be made aware of disciplinary action.
So I have I just have an overall concern about enforceability and what we're trying to attempt in this condition. Even saying a reasonable attempt is still subject to interpretation. And I think if I'm hearing you correctly, the why is to make sure that all people who are practicing within that office is aware, then perhaps you can get there by just saying shall post a notice, which recites the violations. And then that way, if they have either a supervisor or a worksite monitor or even a board inspector go out, they can see that that notice is posted. Everybody is aware of that notice, and it doesn't require any additional paperwork. Correct.
I mean, this currently says that only license holders need to be made aware of the disciplinary action. When you post a notice in a hospital, that means that the whole staff now is made aware, which is not required currently. And if you post a notice, it also could mean that even the public is made aware of this, which, again, I'm not saying I'm against it, but that's essentially what you're saying when you post it, even though it already says it, that that's an option.
Kathy?
I was just going to, kind of going back to the beginning here. Seems like the slippery slope we've all gone down here in terms of discussing this about its intent and its full meaning. Maybe goes back to the fact that that's why it was written for the veterinary employer to notify his or her employees that he or she was on probation for something. I agree, this going back and forth with paperwork and acknowledging and writing is really difficult in practices that are changing a lot every day. But I'm back to even though I would like to see all licensees to be able to acknowledge that, it's just for their protection and for the public protection. It may be that that's why this was written back in the day when it was written, that the employer, because that's the one vet, and if he or she is on probation, has an obligation to notify his employees. So I'm just putting that out there.
So what do you suggest?
So far, I'm hearing a preference for deleting the requirement of all of the other employees to report to the board in writing, acknowledging that the employees have read the accusation and decision. Sounds like we should just delete that provision, but maintain. I think the question right now is whether or not you want to maintain posting or circulating the notice. One thing that's interesting is that the first part of this requirement is to post or circulate a notice, and the second part is that the employees have to actually have read the accusation and decision. So it's either a notice or it's the accusation and decision. So I think we need to clarify what the document is that is making everyone aware of something, and then how is that being communicated to people that work there.
Well, the accusation and the notice give actual information on it that people should know. A notice could be something that's not very meaningful. And I would be cautious to delete anything. It seems like we just need to add some provision that if it's not an owner of a facility, that they have to notify people too. I wouldn't start hacking away and deleting stuff off of here, though.
Yes, Dr. Nunez?
I move that we delete the last sentence.
I second that.
Okay, we have a motion and a second. Any other discussion from the board? Tara, do you want to have anything to say? Anything more?
So just to clarify, deleting the last sentence would be,
Starting with within 15 days.
right. Okay. I have nothing further to add.
So, I'm sorry, just to clarify then, what's going to either be posted or circulated, it would be a notice that it would be on the probationer to then create and post, and that notice has to include violations for which respondent has been disciplined and the terms and conditions of probation. So not necessarily
Yes.
the accusation.
Yes, and
Yeah.
perhaps
Recites
it's
the
the board that should provide that notice, because like, as you just interpreted that, it means that the notice could be in the respondent's own words.
Correct. And so if you want, you could add a notice as approved by the board, which I don't know if the term actually is needed, but approved by the board, which recites the violations for which respondent has been disciplined and terms and conditions of
You
probation.
can say a notice
Provided by.
provided by the board, comma, provided or approved by the board, comma, which actually recites the violation.
Okay, any other discussion?
I think we have to change the the words of the veterinary practice, we already do that? Involved in his or her veterinary
I
practice?
think Tara changed it to the veterinary practice. Sorry, thank you.
Well, I would prefer
Premises?
at the
Premises.
veterinary premises.
Okay, we have veterinary
Me too.
premises.
Veterinary bizarre.
Any other comments?
I think it should all be reread.
Tara, do you want to read this again?
All right. Notice to employees, new term number 9, prior term number 6. Upon or before the effective date of this decision, respondent shall post or circulate a notice, and I don't know that I got all of the words there, provided by the board.
Provided or approved by the board.
Comma, provided or approved by the board, comma.
I'd like to change which to that. I'm going to start over. Upon or before the effective date of this decision, respondent shall post or circulate a notice, comma, provided or approved by the board, comma, that actually recites the violations for which respondent has been disciplined and the terms and conditions of probation to all licensed, registered, or permitted veterinary employees and to any students, residents, and interns at the veterinary premises. And that's the end of that term.
So, I'm sorry, I've been on the stand having to fight semantics on probation conditions. And if you have a probationer who does post or circulate a notice upon or before the effective date, and then a year later takes that notice down, they have still complied with the probation condition because they did it upon or before the effective date. So if you want to keep it throughout the duration of probation, I think it should specify that.
All agreed?
Agreed.
Okay.
Well, I have a little bit of a question about circulate a notice. That's a one-time effort, isn't it? So it's a little bit misleading also.
Should we just say post instead of circulate? So post a notice?
Post is a lot more enforceable because we
Yeah.
can send someone out to make sure that notice is still posted.
Okay, so the revisions we're contemplating are strike upon or before the effective date of this decision. Begin the sentence with respondent shall post a notice, comma, provided or approved by the board, comma, that actually recites the violations for which respondent has been disciplined and the terms and conditions of probation to all licensed, registered, or permanent veterinary employees and any students, residents, and interns at the veterinary premises.
For the duration
Yeah, does it say for the
of
duration?
their
So you
probation.
could do respondent shall post a notice for the duration of probation or a notice provided or approved by the board
During the probationary period.
throughout yeah.
You can even start that, the whole thing with that, right? Throughout the probationary period, respondents shall post a notice. It's a very long sentence.
And I'm going to get really even. You're going to throw something at me.
Oh.
But
Let me find my
is
gavel.
it a permitted veterinary employee or is it a permitted employee? Because the animal controlled substance permit holder is not a veterinarian. So
I think that's where the permitted veterinary employee is for those people.
I know, but should it be just a permitted employee?
That would be fine. I mean, that's consistent with the construction of this sentence to all licensed, registered, or permanent employees.
That would help with the length.
Well, perhaps veterinary it's just slightly more specific because
Veterinary is
other
never
people,
Permitted substance holders are never referred to as veterinarians.
no, but they're
There it is.
a veterinary employee.
But you say licensed and don't say veterinarian, and you say registered, and you don't say veterinary technicians, but then when you say permitted, you add a veterinary to it.
Why don't we
Right,
just take
that
off?
actually,
They're all
it's all
licensed veterinary
licensed veterinary employees.
Veterinary is applied to all three of those
Yes.
terms.
Yes.
And you didn't throw anything at me.
All right, so should we read this one more time?
One more time.
Okay. Throughout the probationary period, comma, respondent shall post a notice, comma, provided or approved by the board, comma, that actually recites the violations for which respondent has been disciplined and the terms and conditions of probation to all licensed. All right, so to all doesn't make any sense. They just need to post it.
Correct.
So, that for which respondent has been disciplined, and we don't need to notify at that point. They just
Yeah.
need to post it at the veterinary premises.
Correct.
But maybe not.
Oh, I like
Needs to
accessible.
be
Yeah, it has to be
somewhere
accessible.
accessible, because otherwise they're going to post it in the closet.
Yeah.
That was one of my comments.
Yes.
That was one of my comments, is where are you posting this?
Yes. Yeah.
But the other one is, what is actually recites? Maybe put an F in front of it, and you could factually recite it,
Where are we?
but actually,
That was
Oh, here, right here.
That was my,
And if you put an S in front of
Take
it,
out
you can
actually.
sexually advise.
that sounds like my
Just play
niece,
the
you know,
sound.
on her phone.
Or which
Actually,
detail.
literally.
right,
so-
thank you. Can we just take out
Totally.
actually?
Yeah.
And then
say post.
accessible or visible.
How about conspicuous location?
Visible, conspicuous, then it could be interpreted mean it has to be in the front. I mean, I think visible to the employees and the licensees is what we're
Seems like
trying
we're
to
moving
achieve.
too far away from where we started now, that it can be in a closet or a kitchen or under the shelf. I think to all was good. I don't think to take to all out is good.
And we can, if we leave it, you could do conspicuously posted to all licensed, registered, or permitted veterinary employees.
I think we need to clarify that we're posting in a manner that is readily visible to all.
Dr. Nolan, do you have a? That's what I was going to mention.
I know there's terminology that we use for all of our other postings that's somewhere in regs, so.
So, oh, we got, do we
Yeah,
get?
I think they're still, are you still pondering?
Yes, he's still writing it. And I'm like, how do we make this into
Did you have a comment?
I did. I wanted to say that a lot of times, and in a lot of different areas, this might potentially be something to consider for other language. Post doesn't just mean physically anymore, right? If the practice is one that, or premise is one, I don't know which one to use to make her happy, is one that is very much online or paperless, that might be a commonly used communication method within that group of people. I don't know if
Good
it'll have a
point.
factor or not, but I wanted to point that out.
Good point. We actually mean a physical sign.
I think that could come under a notice provided or approved by the board, and I think that we can provide that clarification. I don't see them wanting to post this on their Facebook page, and it's something that we can let them know that during an inspection, or if we're out there, we'll look for a notice be posted.
Okay, Tara, are you still working?
I'm almost there. Okay, how does this sound? Throughout the probationary period and in a manner that is visible to all licensed, registered, or permitted veterinary employees at the veterinary premises, comma, respondent shall post a notice, comma, provided or approved by the board, comma, that recites the violations for which respondent has been disciplined and the terms and conditions of probation, period.
Nice.
I like it.
I like it too.
Okay, are we all in agreement on that one?
Thank you
Wait,
all.
what, should we oh,
In a,
At the
con-
veterinary premises,
it's in an area conspicuous?
in a manner that is visible to all licensed, registered, or permitted veterinary employees at the veterinary premises. Okay, so we had a motion, we had a second. Dr. Nunez, you moved. Do you want to revise your motions to what we just read? Okay.
Yes,
Can we just-
I will revise that motion.
Or do you just want to withdraw your motion and we move on?
If that would be
Which-
easier,
which
I
do
can
you
do
prefer?
that as well.
I think for the record's sake, I think it'd be easier if we continue on and then make one final motion at the end.
That's true. We should do that.
Okay. Nat.
So are you withdrawing your motion on this term?
I don't even remember making it, to
And
be
I
honest.
forget who's second, who's the second?
I was the second, and it was just a motion to strike the last sentence.
Okay.
Yeah.
Withdrawn?
So you both withdraw?
Yes.
Okay.
We did make that motion, didn't we?
Okay, so moving on. Page 19. Supervised practice. I have a comment here that the board needs to discuss why this change is necessary. And I think it's the removal of all costs involved with practice supervision shall be borne by respondent. Normally, when we're removing it in one area, we're moving it to another. But I don't see that being replaced anywhere. So I'm wondering why we wouldn't require the respondent to pay all costs associated with the practice supervision.
And I do have a concern with removing it because it is in there. The argument could be from opposing counsel that the board took it out with the intent of not making them have to pay for any costs that are associated, if there are, with practice supervision. So I don't know what the intent of the board was to take this out.
I think I thought I remember that, there was some discussion about it might not be easy to find a supervisor in some of these remote areas. And if a respondent is not allowed to practice until they find a supervisor, and a supervisor is not easily found in that area, then it might be financially disastrous. I think that was that discussion in striking it, I believe.
So would the intent be then that the board would then pay for any practice supervision?
I know that
No,
was not the intent.
That was not the intent.
I think it was related to the difficulty in finding a supervisor.
or was it related to actually a supervising veterinarian that has employed the respondent, not charging or something? Do you remember something about the willingness of an employee to?
Yeah,
I don't remember taking
like
this
a
I don't
out.
respondent,
remember.
a respondent has to hire a new person to be the supervisor.
Kathy?
Excuse me, I don't recall deleting this. Gosh, I'm sorry,
I
but
don't either.
I thought, isn't the cost involved with practice supervision borne by the respondent covered somewhere else? Maybe we removed it here because it was redundant. Because it is covered by the respondent or the supervision costs. generally.
I think I think it was involved in these situations where the respondent would have to actually hire a new veterinarian to be a supervisor.
I could see further down where
I think
they were
that's-
talking about it not being somebody who works there, an
Oh.
associate or any of
That's
that.
where I think we deleted it there because of the inability to sometimes find someone that was completely independent.
That's like, I have like concerns. If you're being compensated.
Am I just paying?
But
It seems like if you.
Right,
Yeah.
so I do have a concern with a probationer paying for the supervision. Because is the probationer then paying a supervisor, is that a conflict? Are they paying for good supervision to what the probationer believes is good supervision?
and it's also adding to the proposed decision, isn't it, as far as cost recovery or fees?
No, cost recovery would be
Or
separate.
fees, I mean,
I agree. I could see a potential conflict of interest there if you're paying your supervisor. But I also see, Dr. Nunez, earlier you talked about how it might be difficult for a remote practitioner to find a supervisor. So it looks like to address that, we are striking the supervisor shall be independent with no prior business or personal relationship with respondent, so that they could just utilize someone potentially in their current practice for the supervision. And if that's the case, what costs would be associated with it?
Do you remember striking the, all costs will be borne by the respondent? Do you remember striking that?
I remember someone saying that the respondent is responsible for all the
Yes.
costs. I don't remember
Yes.
it being stricken.
And Amanda says that we did it in October of 2015, but she's trying to find the language around it. But I still thought it was,
I'm looking at the
Considered
old
somewhere
agenda
else.
materials, and it was stricken in October of 2015. I'm trying to find out why.
Why?
So,
that was,
Can I ask what it usually costs to have a supervisor do 50% supervision or something like that? Does the board know that?
That would not be something for the board. I mean, that would be whatever agreement was between the probationer and the supervisor. We would not even want to begin to get involved in what they charge for something.
Do you know if they typically pay their supervisor?
This is the first I've heard of a cost for a supervisor, so I don't know.
Yeah, that's kind of my point. I mean, many years ago, I don't know if I was an official supervisor, I mean, this was 20 years ago, but it seems like that's kind of something to be worked out between the supervisor and the probationer, and they deal with it. And if the employer who's going to be the supervisor says, well, look, this is going to be a little bit of extra work, so I'm going to pay you $2,000 less, then fine, they work it out. If your point is, if
Speaking, and can they use the microphone?
Ken is speaking and I'm using it, I'll yell. How's that?
Who, I'm sorry, who is it?
Ken Pulowski.
Oh, okay, thank you.
You're welcome. So if your point is that you want to make sure that the board is not responsible for incurring any costs, then state that. But to put this in seems a little wonky and put something into the head, the thoughts of supervisors that, well, am I supposed to be getting paid to do this? And then you do get into the conflict of interests. I think you leave that up to the supervisor and the probationer, and if you want the board out of it, then state something to that effect.
I still don't like that, because it introduces the possibility of the board being responsible for costs.
The supervisor has to be approved by the probation monitor, correct?
Correct.
So we don't care if they're paid
Yeah.
or not paid. It's just that we approve them, that they are, you know, professional, there's no conflict, there should be, you know, the highest regards for this person, there's no disciplinary action against them. So we have our criteria, but it doesn't matter if they're paid or not.
The
Yes.
concern is that the board may have to pay for it.
No, the concern is that a respondent may not be able to get a supervisor unless he or she pays for one.
Well, that's the break. I mean, that's what's been going on, and that's the break of the game, right?
It may have been that we took this line out because it really wasn't relevant. It was again what Dr. Pawlowski said, between the supervisor and the probationer, and there was no cost implied, and we weren't paying it, and if there is something to be paid, that's between the vet and the supervisor. And maybe that's why this line was removed. Because if we,
That would make sense.
It's like, will council try and say the board has to pay for this? Do we need a statement saying that?
I think it's preferable to at least have something like any cost associated with practice supervision shall be borne by the respondent. That way, you know, if there is any kind of cost associated, this isn't saying that there will be one.
Exactly.
It's just if there is a cost.
So, are we okay with putting that statement back in?
Will be is a mandate, and that puts it on then the supervisor to determine what the costs are. So it should be, you know, maybe, or, you know, I mean, say something that excludes the board, but don't say if there are costs, because the supervisor may determine, I don't care, you know, they want, you know, they were a good employee, they want them there, they still want them, and doesn't want to charge. But if you say will be, you're saying that the supervisor has to charge if they determine there are some types of costs.
Right, well, who else is going to pay for it? The board's not.
The supervisor. If the supervisor is a practice owner and they have an employee that they are supervising, they may choose to bear the cost, whatever that cost is, you know, that they have to review their records for a couple hours each week. That's a cost. So now, do they have to go and figure, well, my time is worth $100 an hour, so that's $200, so now I need to bill the probationer $200 for my time to review their records?
No, it's not saying that. It's just saying,
Well,
it's saying if there is a cost. it
If
will
there
not.
is a cost, but where, I mean, I'm just saying, you could go down a rabbit hole and say that there are costs. So Dr. Waterhouse, if you had to spend 2 hours of your time doing something, is that a cost?
Yes.
Okay, so that's a cost. So now you have to bill, you know, that's a cost.
That's a
So
cost to
I'm-
me.
It's a
Yes.
cost to you because you're supervising somebody. So you don't make it mandatory, make it optional, that if there are costs, they, you know, they would be covered, but don't say they have to be. I mean, that's what I'm saying. You're trying to exempt the board from any costs. So say something about the board will not bear, no costs will be borne to the board for the supervision, something along those lines. But don't say that the respondent has to pay any costs when nobody may want to charge them anything.
So,
I don't read it that way. But Dr. Bradbury?
Can we just say somewhere in this whole document that the probationer is responsible for any and all costs associated with their probation and have it as a blanket term for all of this?
we have probation costs, then we have drug testing costs that go to a separate entity. So I think it's been broken out to each term that might have a cost associated with it to, you know, remind the respondent that this is a potential cost they're going to need to pay themselves. I don't like the idea of adding that the board shall not bear any costs associated with supervised practice, because that introduces the idea that the board could be responsible for any of these costs. So, you know, we need to either strike it, and because the board is, I mean, are we aware that there is an actual cost associated with it? For sure. Because if not, perhaps we're striking it
Oh, there
because.
could be. There absolutely
There
could be.
could be, but we don't know
I would say
because
in
of the
majority
type of
cases-
arrangement that may be agreed to
There
between
could
the.
be, but it could very likely be that the supervisor is willing to waive those costs, those potential costs. There may not be hard costs.
Yes.
But there may be supervisory costs, like I said, reviewing records, those types of things, but the supervisor may choose not. But if you say that the respondent is responsible, will be responsible for any costs, you're saying they have to pay for those, when the supervisor may not want them to pay for, or may not
Right.
require them to pay for those.
That's why I'm changing this to any costs associated with practice supervision shall be borne by the respondent, because if they agree that there will be no cost, then there's no cost to bear. The point is that the respondent is the one who's working this out, not the board.
Which I understand you want. You're the legal mind, so if you say that's what it says, to me, it still is interpreted that they would have to pay any costs. I mean, put a may be responsible, or, but
If
you
there
can
are
figure
any
that out.
costs.
Yeah. Any costs that might be involved.
That may arise, or just strike it.
I'm fine with the language that I read. I
Can
mean,
you read that again?
any costs associated with practice supervision shall be borne by the respondent.
That seems,
So,
Well,
to me, it
if-
says that if there is any costs,
Yeah.
then they are paid by the respondent.
That covers an if there's any, yeah.
So, are we okay with what Tara read? Since it's 2 minutes to 3?
And we haven't voted on anything yet.
No.
We're going to vote at the end of it.
Yes.
And
Are we
perhaps,
okay with this section?
perhaps when we come back, we can also hear from Amanda. She's going to find out why we crossed it off in the first place.
I actually went back and watched all of the old webcasts when I was writing the rulemaking file, and I have notes on it, and Anne Marie at the time just said for clarity. That's all I have for that, and I did a verbatim, word-for-word transcription. So I'll go listen to it again, but that's all I could find right now.
Ken, I have another option.
Okay.
Any potential costs associated with practice supervision shall be borne by the respondent. Okay.
Okay.
So what I'd like to point out here is that you see all costs involved with practice supervision shall be borne by respondent. In reality, we're only going to be striking all and replacing all with any potential. Keep costs,
It's the same thing, it's the same thing.
it's similar.
We're glad you're happy.
It's a little, yeah.
We're going to strike involved
Um,
and insert associated.
Okay, so are we okay with this? Okay. This is now 1 minute till 3.
Can we,
23 is just a direction that we're reverting the language back to the way it was.
Okay, sorry, where were we?
On page 23, abstain from controlled substances. We were going to change it to Business and Professions Code, Section 4021, but instead, we're just maintaining the California Uniform Controlled Substances Act, and in parentheses, adding the location of that act, which is under the Health and Safety Code, Section 11,000 et sec. So that's not really a discussion point, it's really just letting you know that we're making that change.
Okay,
That's all I've got.
so we're okay on this? Can we go back to page 20, under 67, no new ownership?
yes, or corporation, and then it goes to during.
So in the last part of that sentence, it says during the duration. Is that really what you mean to say?
Do you want for the duration?
Just during the duration sounds kind of weird.
During the duration.
Would everyone agree to changing during the duration to for the duration? Any questions or comments on that? We're going to also make that change to term 8, no management, changing during the duration to for the duration.
We can make a blanket understanding that any instances of these conditions where it says during the duration of, we can change to for the duration of.
Any other questions or comments on the disciplinary guidelines?
I hate to say this, but I did have a couple places where I thought ethics training should be added too. On page 6, under failure to keep the licensee's registrant's premises in clean and sanitary condition, and also under negligence, I thought we should add ethics. Page 6 and page 7, whether we should consider ethics training and
We would have to explain how ethics relates to keeping the premises and equipment sanitary.
well, I think it is kind of an ethical thing.
Cleanliness is next to godliness.
It's kind of inherent.
Okay, but I understood that it is something we can add whenever we want.
Again, but the judge isn't going to see it
Well, I guess I would
necessarily.
probably agree with Tara on the cleanliness one.
Okay, how about negligence?
Yes, that I could see.
Negligence, yes.
That's on the next page, page 7. And how about on page 11, the second one down, impermissible disclosure of information? I think that ethics training should be in there, I think.
Impermissible disclosure.
On the negligence, shouldn't continuing education be on that one too, if we're going to start adding things?
Yes.
Okay, so we're looking at page 7, first term, negligence in the practice of veterinary medicine, adding optional terms, ethics and continuing education,
Yes.
ethiks training.
And then you went to.
And then page 11 in the 4857, impermissible disclosure of information, adding ethics training in there.
Yeah, makes sense.
Is everybody in agreement with that? Okay. Tara, are we there?
I think we are. So let me get my language here. If there is a motion, it should be to approve the proposed regulatory changes as modified, direct the executive officer to take all steps necessary to initiate the rulemaking process, authorize the executive officer to make any technical or non-substantive changes to the rulemaking package, notice the proposed text for a 45-day comment period, and if no adverse comments are received during the 45-day comment period and no hearing is requested, adopt the proposed regulatory changes as modified.
So moved.
I second.
Okay, okay, motion and a second. Any other discussion? Any comments from the public? Can we call for the vote?
Ms. Bowler?
Aye.
Dr. Bradbury? Ms. Loretta?
Yes.
Ms. Mancuso?
Yes.
Dr. Noland?
Yes.
Dr. Nunez?
Yes.
Ms. Yanis?
Yes.
House?
Yes.
Motion carries.
Motion carries, thank you. Okay,
Yay.
so now we are going to go into closed session. We're going to take a bathroom break first, but we're going to go into closed session and we will, so then reconvene tomorrow morning.
Oh.
Tomorrow morning at 9 a.m.
No.
Okay.
So we stand by until you're done with your potty break?
Yes.
Yeah.